Great, so we'll start with the recap. As I said, we'll do that briefly now. And if anyone else wants to highlight any messages that they took away from yesterday, please feel free to either just unmute yourself or raise your hand. Then we'll start with session 5, and that's looking at COVID-19 vaccine procurement specifically. And we'll start there with an overview of the African Medical Supplies Platform and AVAT by Chidinma Ifepe from the African Medical Supplies Platform. We'll then move on to Dr. Diop Samba from Senegal, who will discuss emergency procurement and balancing efficiency and accountability. So that's the information that was included in the case study on emergency procurement sent around last week. That'll be facilitated by my colleague Fredris. Then we'll share the results of the poll, we're also going to do a poll early this morning now. And then we'll take a short break and start with session 6, looking at rollout and distribution. So there we'll hear from the WHO again, Dr. Helene Broa, on their scoping review and vaccine rollout. And then we'll hear about how Nigeria has planned for their COVID-19 program rollout. And again, we'll allow some time for Q&A and move on to concluding remarks. Thank you very much. And here we'll go through some of the key messages from yesterday. So these are essentially just some of the high-level messages that were discussed and how and just communicating and summarizing yesterday. So the first thing that we heard was that vaccination against COVID-19 is the most efficient measure to mitigate against loss of lives and further economic disruption on the continent. And then without significant external and domestic resources allocated to the vaccine throughout Africa, we risk COVID-19 becoming yet another poor country disease. That was something that Jode Moore said. And then we know that domestic resources are crucial for closing the financing gap for COVID-19 vaccination programs, but we're not seeing this really happen as much, or at least it's not being communicated to us or publicized. And allocating these resources through budget documents and publicizing it will ensure that we signal commitment externally and also catalyze external support. So essentially, without signaling that showing that our budgets, that we're budgeting ourselves, we cannot expect external partners to catalyze their own resources. And we simply still do not have enough information on how countries are actually financing, budgeting, and procuring the COVID-19 vaccine. And without this, these sort of opportunities for peer exchange and learning and cross-continental and regional unity are quite limited. So it's just about getting that information out there and sharing the specificities of what's going on. So also in financing and procuring the vaccine in Africa, this is what Vice Minister Ahmed Kutchuk from Egypt said, is that a common approach and language needs to be adopted, and the language needs to be that of the lowest common denominator, whereas we don't leave any country behind. And we also spoke about some of the limitations around pool procurement mechanisms, and we agree that they are essential, but that what is also required is harmonization and coordination in the financing, regulation, and distribution of the vaccine. We can move on to the next slide, thank you. So we also spoke a lot about the uncertainties associated with vaccination programs and their costing and the different scenarios that may or may not unfold, and that this requires unusual degrees of budgetary flexibility, but also that this must be accompanied by even greater levels of transparency and accountability. We also discussed that these uncertainties in the costing, in what will be required, also require shorter feedback loops, more frequent meetings, and enhanced coordination and dialogue between ministries of finance and health. So we heard in South Africa, there's meetings every day or every second day between the ministries of finance and health. And I think that seems to be a trend across the continent, and emphasizing how important this sort of coordination and dialogue is, especially when there's so much uncertainty. And then we discussed how variance in vaccine prices and this lack of price transparency from manufacturers also contributes to the costing uncertainties, and how important this transparency is, and that potentially it can come about through putting pressure on through regional unity. We've also discussed how supply constraints have necessitated that countries procure from multiple manufacturers. We saw in Mauritius, I think there were 5 different manufacturers that they were procuring from, and how this creates administrative, logistical, and financial challenges, which may be inevitable, but may also be mitigated by further cross-country collaboration and some more regional procurement mechanisms. And finally, while debt levels may be reaching unsustainable levels, we're aware of this, the return on investment of the COVID-19 vaccine may very well outweigh debt service costs, and therefore there may be an argument for borrowing to finance the vaccine. So those were our key messages. There's around 10. We'll also send them around to you and post them on the website. But yeah, those are essentially the key things that came out of yesterday, and we'll have similar key messages that come out from today. Thank you very much. I think we can now move on to the poll. I think yesterday we got 9 countries responding. Hopefully we get a similar amount today. We'll start with the English poll. Thank you very much. So the first question is your government procuring the COVID-19 vaccine through direct deals, so that's direct procurement, rather than relying exclusively on donations from COVAX or bilateral partners? So then you get different options there. And we asked if are you using any regional purchasing blocks? So this isn't the African Medical Supplies Platform or COVAX, to procure any of the essentials or the vaccine. And then there's a question on whether you've made any deviations in your usual procurement rules that have allowed you to participate in the pooled procurement mechanisms. And finally, if you scroll down, we have established a national COVID-19 vaccine task team or similar, which includes the Ministry of Finance or Budget and Ministry of Health. And there's a yes or a no, or that it may not include the Ministry of Finance. So 4 questions for you to answer. We'll allow 5 minutes for this, and then 5 minutes for the French. And then we can start getting ready for our next session that will be facilitated by freshers. Thanks.
Bonjour.
Good morning.
Yeah, by Samba Job from Senegal.
Thank you. Well, thank you. Welcome, and I'm glad you could join. Thanks so much.
Thank you. Thank you.
We can hear you well. Thank you.
I'm just connected. I'd like to say that who will be the first presenter?
Dinmel will present, and then you'll come on.
Okay, thank you.
And we're going to start with that in about 5 minutes. Thanks so much. And if we can keep going with the poll, we're going to put the English off in about 2 minutes, and then we'll go to the French. And we'll start with our session in 2 minutes with freshers. Morning, freshers.
Hi, Daniel.
Glad you could connect.
Yes, I had some internet issues this morning, but thanks God I was able to join.
So we'll give 1 more minute for the English, and then Fridges, I think you can begin in about a minute. And people can continue filling out the poll in French while your session commences.
Okay.
So yeah, 1 minute, thank you. The French poll is on now, and I think participants can keep answering while you go ahead, Fridges. Thank you.
All right. So, merci beaucoup, Daniel. Bonjour à tous. Merci encore de nous avoir rejoints pour cette deuxième journée de réflexion, d'apprentissage et de partage d'expériences sur l'achat, le financement et la distribution des vaccins de la COVID-19. Hier, nous avons eu des discussions vraiment très dynamiques et pertinentes sur comment les gouvernements ont budgétisé et levé des fonds suffisants pour l'achat du vaccin anti-COVID-19. Toutefois, il est tout aussi important de savoir comment les gouvernements peuvent se procurer les vaccins de manière plus efficiente et efficace. Autrement dit, tout en garantissant l'optimisation des ressources budgétaires impliquées. Pour cela, 2 options ont été mises sur la table hier par les gouvernements, notamment l'achat direct et l'achat groupé. Au cours de cette séance que j'aurai le plaisir et l'honneur de faciliter, nous verrons ensemble comment ces options d'achat ont été utilisées et décidées pendant la crise actuelle, et aussi comment les pays ont réussi à faire la balance justement entre les préoccupations liées à l'efficience, à la responsabilité, mais aussi à la transparence en matière d'achat dans un contexte d'urgence pandémique. Je serai rejoint dans ce panel par Madame Chindima Ifepe, qui est responsable des opérations d'une initiative lancée par l'Union africaine, initiative dénommée Plateforme pour les fournitures médicales en Afrique. Avec Madame Ifepe, nous discuterons globalement du mandat de sa structure, mais également des engagements d'achat anticipés. Notre deuxième panéliste nous rejoint depuis le pays de la Teranga, le Sénégal. Il s'agit du docteur Diop Samba, en charge de la réglementation et des affaires juridiques au sein de l'autorité de régulation des marchés publics du Sénégal, une structure qui a beaucoup été impliquée dans la réponse à la COVID-19, notamment pour ce qui concerne le support aux autorités contractantes en matière de passation de marché. Merci beaucoup, Madame Ifepe et Dr Diop, de nous avoir rejoints aujourd'hui. Sans plus tarder, je vais inviter ici Madame Ifepe pour sa présentation. Et naturellement, vous aurez l'occasion, chers participants, de poser des questions au fur et à mesure en utilisant le chat box. À vous, Madame Chidima.
Thank you so much. So just to kick off, I will want to appreciate the coordinators for inviting us on this session. And I want to tell you a little bit more about the African Medical Supplies Platform. We are a digital marketplace and a pool procurement mechanism that have since June 2020 been supplying buying entities, governments on the African continent, and large pharmaceutical companies with critical medical supplies and with, other products. We deal with PPEs, clinical management devices, diagnostic kits, drugs, and vaccines. So the marketplace or the pool procurement mechanism we have as the AMSP does at least these 5 categories of products. The platform works in 5 simple steps. So it is like your regular e-commerce platform. Once you come onto the platform, you place an order. Once you come onto the platform and you have your credentials to log in, you can just place an order based on your choices. Once you've looked through the supply catalog, after placing an order, the buying entity or the organization just reviews, makes payments. Once the payments are completed, the seller then, will prepare the shipments and the items are delivered to the countries. So that's just the overview on the AMSP and what we currently do today. Now, since our inception, our mandate has quickly expanded. So that means our mandate has gone beyond just managing diagnostic kits and PPEs. And we have also been working alongside with the African Vaccine Acquisition Task Team and the African Union and African CDC on vaccine-related topics. So to give you a little bit of context, when the conversations around vaccines started, African CDC had quickly recommended that for Africa to achieve herd immunity, we need to vaccinate at least 60% of the population. But we also knew at the time that COVAX was going to be supplying a specific percentage to the continent, something around 20 to 27% to the continent. What this meant was there was still a deficit to be bridged in order. Yeah, please, could you go on mute, ma'am? Apologies for that, everyone. So what we quickly realized was there was still a deficit in terms of like financing and in terms of the total quantity of vaccines that were needed on the continent. And in this respect, the chairperson at the time, President Cyril Ramaphosa, he inaugurated an African Vaccine Acquisition Task Team who had certain objectives and a certain goal. So what you're looking at the screen is just where their efforts had to be concentrated. They were tasked with securing adequate amounts of safe and efficacious vaccines. So what this means is they needed to go out and search not just for the vaccines itself, but what they needed to also be looking out for is to make sure that these efficacious vaccines were enough to vaccinate at least 60% of the African population. This task team also had to kind of estimate the funding needs for the vaccine procurement and the delivery. And it also needed to create a financing mechanism that was required to ensure that all African Union member states can access and they can also receive the vaccine doses that were needed to reach a minimum of 60% immunization. Next slide, please. So what we've been talking about is just who AVAT is, what they've done. But one of the things that AVAT then came up with in a bid to continue their efforts. Remember that we already had COVAX. COVAX was providing 20 to 27% of the vaccines that were needed on the continent, but we still needed to get enough vaccines to get us to 60%. So AVAT, they had to look for not just the supply of the vaccines, they had to look for the financing mechanism. So in order to do this, AVAT principals, they obviously started engaging amongst themselves and amongst the different manufacturers. And one other thing that they came up with is the advanced procurement commitment. So the advanced procurement commitment, it's a mechanism that was structured by AVAT, and they structured this in collaboration with the African Export-Import Bank. And this mechanism is really aimed at ensuring, Africa can access COVID-19 vaccines as soon as possible. We wanted access to happen quickly. We also wanted to use this mechanism to provide assurance to the vaccine manufacturers that all the vaccines that were going to be ordered were firm orders and will be paid for. So one of the challenges that were also identified early on is, vaccine manufacturers, they wanted two major things. They wanted, one, large volumes. I mean, we were going into the market late. Western countries had ordered tons and tons of quantities of vaccines. So Africa, we were going to the market a little later than others. So they wanted to know that we were coming with, with volumes. Africa is currently some 1.3 billion population size. So going into conversations with this kind of quantity also, gives us a seat at the table. But they also wanted to be assured that payment, when due, will be made. So AVAD came up with this advanced procurement commitment mechanism as a means to structure the conversation around vaccine acquisition under the African Union. What you see on the screen is also just some of the objectives that AVAD had been targeting. One, they wanted to, the APC is, one of its sole aims was to guarantee Africa's access to COVID-19 vaccines in a manner that reduces the fiscal burden on member countries. You remember that even before COVID, Africa had been dealing with multiple different, whether it's endemic diseases or different issues. So COVID is just one more problem, or if I can put it like that has been added onto the already very strained resources on the continent. So the idea was to make sure that it reduces the fiscal burden on member countries while ensuring a timely, equitable, and cost-effective availability of these vaccines within the continent. And why we also wanted this timely, equitable, and cost-effective approach is because there is the need to mitigate the protracted financial and socio-economic costs of the COVID-19. COVID-19 with shutdowns and lockdowns, it also affects, for governments that tax businesses, etc. in their different countries. It also reduced the source of, the source of revenues in those countries. Same for the government, same for its citizens. So whatever proposal or proposition was put forward, it needs to kind of take into consideration some of the already strained, financial environment existing in the countries. And finally, the APC, one of its objectives was to provide a credible platform around which a blend of funding can be attached. So it's not just, government will not only use one source of funding. Some governments are going to use a mix and match of funding options to be able to finance this additional vaccine acquisition. Next slide, please. What you're seeing on the screen now is just a visual representation of, what I've been saying, right? In collaboration with AVAT, the Africa Export-Import Bank, had come up with some sort of financing structure. COVAX and the donors were going to be providing at least 27% of coverage for the continent, for eligible countries. That means we still had a long ways to go to 60% that had been the target herd immunity level that was proposed by the African CDC. So the APC, which was created in collaboration with the AVAD by the African Bank, now, they came up with one particular solution in terms of financing. They were going to be financing 15% of the total vaccine requirements for the continent. This came up to some $2 billion that were going to be needed to finance just 15% of the additional requirements for the continent. So 27% plus 15%, that's some 42, I think. Yeah, so 42% that had now been covered between Afrexim and COVAX. There were also other discussions around financing structure. A lot of the countries had already started having conversations with the World Bank. So the World Bank had made some commitments to some countries of providing an extra 18% financing for some of these countries. So what you're seeing on the screen is the path to financing the 60% doses that were required for the African continent. So that's just a visual representation. What you also don't see here is that some countries that might not be using any of the, whether it's Afrexim financing through the APC mechanism or the bank or the World Bank's financing option. Some countries they might be opting to pay cash or using their own fundraise. That some countries are doing self-fundraising with their own different pool of donors. So they will be funding this differently. Some other countries, they don't have the resources and they will be utilizing Afrexim's funding facility. The good thing about the funding facility across the board is it offers countries up to 5 years repayment guarantees, right? So even though upfront Afrexim will be putting up this $2 billion of guarantee to each vaccine manufacturer when necessary, countries then could only pay back it ranges from, I think, 1 to 5 years. So they had the option of paying back a little bit at their own pace, if I could put it like this, over this long-term period. Afrexim Bank and its board, again, the good thing is this is just not an opportunity it wasn't an opportunity for them to maybe the word make money or anything. This was more a critical concern to support the continent. Afrexim, for people on the call that we don't know, they are an African, trade and financing bank. So their core market is in Africa. So this whole APC structure was one of the highlights that had been organized under AVAT. Next slide, please. So since we had since the early days on, the announcement in January, there's a few achievements that have been recorded that I'd like to share today on the call. So far, we've mentioned the AMSP and who we are, how we fit into this whole conversation. We've also talked about a little bit around the APC, AVAT, and the financing options. What I'd like to also share today is, since that conversation started, we have recorded 30 African Union member states that have signed up, to use the African Union's AVAT to procure vaccines for their countries. COVAX is providing 27%, as I shared earlier, but for some countries whose targets are up to 60%, they also needed to, source alternative funding and source from other, areas how to, vaccinate the remainder population. For some countries, 27% will cover the frontline workers, health workers, and the vulnerable population, but there's still other people to vaccinate. So one of the big achievements we're super proud of is 30 countries so far have signed up, to use AVAT to procure vaccines for their citizens. One of the other bigger announcements that we released a few days ago was AVAT's conclusion with signing with Johnson & Johnson. So we have a firm contract now covering 220 million doses and an option to purchase an extra 180 million from Johnson & Johnson. When AVAT initially announced the conversation around the acquisition of vaccines, what we had were provisional offers for 270 million doses. But Johnson & Johnson, we are now getting up to 400 million doses of vaccines for the continent. We have also in very advanced stages of concluding with Pfizer. So Pfizer is still another big option that it's being finalized on the AVAT side as part of the vaccine manufacturing options. We are also still in talks with some other manufacturers that will be announced as the contracts get finalized. But we wanted to share also to the group today some of the achievements from AVAT. And with this, what we'd like to do now is just also stop here and hand over back to Mr. Moderator. Thank you so much.
Merci beaucoup, Madame IFP, pour cette intéressante introduction et, on va dire, présentation globale de votre mandat et aussi des résultats que vous avez pu obtenir jusqu'ici, notamment avec 30 pays de l'Afrique qui ont naturellement signé avec votre mécanisme. Nous avons déjà des questions qui nous viennent dans le chat et nous avons aussi pas mal de questions à vous poser, mais sur lesquelles nous allons revenir naturellement plus tard. Mais je vais demander je vais aussi inviter les pays qui sont autour de cette discussion d'essayer d'identifier et de préparer aussi leurs questions sur leur expérience dans l'utilisation naturellement de ce mécanisme et sur lesquels nous allons revenir pendant la session des questions et réponses. Mais avant, j'aimerais sûrement inviter ici le docteur Diop Samba pour sa présentation sur le financement des vaccins COVID au Sénégal et le rôle qu'a joué justement l'autorité de régulation des marchés publics. Monsieur Diop.
Allô, est-ce que vous me recevez? Allô?
Oui, nous vous recevons très bien.
Merci
très
beaucoup.
Bien. Et nous avons aussi votre présentation.
Merci beaucoup. Donc je vais arrêter le partage et vous laisser dérouler la présentation au lieu de partager mon écran. Ou bien si vous souhaitez aussi, je peux partager mon écran.
Je pense que nous le ferons à notre niveau. Merci.
D'accord, merci. Merci beaucoup. Donc, oui. Merci beaucoup. C'est avec beaucoup de plaisir que nous allons vous présenter le financement des vaccins dans le cadre de la COVID-19 au Sénégal. Next slide, s'il vous plaît. En fait, la problématique qu'il convient de se poser, c'est comment conjuguer la question de l'urgence et la nécessité de respecter les règles de procédure de passation des marchés. How to adapt to the urgence integrated to the purchase of goods service to fight against COVID-19. Donc, comment effectivement adresser la question de la COVID tout en respectant les principes de passation des marchés publics. Je vous en prie. Next slide. Et dans ce cadre, il faudrait relever que le Sénégal, quand même, n'est pas un pays producteur de vaccins pour le moment. Si vous avez écouté l'actualité, la presse sénégalaise ce matin, le président même de la République disait que nous allons vers la fabrique. Mais ce qu'il faudrait retenir, c'est que aujourd'hui, on a mis en place la force COVID-19, qui est une entité à qui l'État a confié 69 millions de francs CFA pour faire face, 69 milliards de francs CFA pour faire face quand même à la crise face de la COVID-19. Et cette pandémie, il faudrait le relever, au Sénégal quand même a impacté l'économie et a menacé les perspectives de croissance d'ici 2035. Oui, prochain slide. Par rapport au cadre juridique, ce qu'il faudrait préciser maintenant, c'est que le cadre juridique des marchés publics au Sénégal est encadré par le décret 2014-12-12, qui est le cadre de référence pour la passation des marchés publics. Cependant, lorsqu'il est intervenu la COVID-19, le président de la République a pris un décret pour procéder effectivement à l'exemption des acquisitions qui se feront dans le cadre de la COVID-19 de l'application du Code des marchés publics. Autrement dit, toutes les acquisitions qui seront commises dans le cadre de la COVID-19 pourraient bel et bien être faites hors du champ d'application du Code des marchés publics. Malgré quand même cette possibilité, lorsque les ministères de la Solidarité nationale a voulu acheter des denrées alimentaires pour venir pour assistance, quand même, ils ont demandé l'avis de l'ARMP. Maintenant, ce décret est abrogé par le décret 2020-1774 du 16 septembre 2020. Toutefois, ce qu'il faudrait préciser, c'est que le cadre juridique actuel encadre bel et bien les questions de la question de la COVID-19. Parce que le décret 2014-12 prévoit que lorsqu'il y a des médicaments qui sont essentiels pour la médecine d'urgence, le ministère de la Santé peut demander l'avis de l'organe de régulation pour pouvoir les passer sans respecter les procédures d'appel d'offres. Prochaine slide, s'il vous plaît. C'est ce qui a été fait parce que le Sénégal, je n'ai pas besoin de revenir tout de suite sur la question de la définition ECOVAX. Le Sénégal fait partie de l'initiative ECOVAX. Et en même temps, cependant, le Sénégal n'est pas dans cette perspective. Le Sénégal aussi, avec ses partenaires multilatéraux comme la Chine, a pu acquérir 324 000 doses de vaccins. Donc, dans le cadre de l'initiative ECOVAX, le Sénégal est dedans avec d'autres pays africains. Là aussi, c'est dans le respect du Code des marchés publiques. Pourquoi? Parce que le Code des marchés publiques du Sénégal dit que lorsque les règles de procédure de passation de marchés publics au niveau national sont contraires avec une disposition d'une convention internationale ou d'une convention de financement, ce sont les dispositions de la convention internationale ou de la convention de financement qui sont applicables. Et c'est le cas dans le cadre de l'initiative ECOVAX et c'est le cas aussi dans le cadre du partenariat multilatéral. Le principe par rapport au Code des marchés publics, certes, c'est une procédure d'appel d'offres ouvert, c'est le principe. Cependant, le ministère de la Santé a la possibilité de solliciter l'avis de l'ARMP pour avoir l'autorisation de faire l'action directe. Non seulement le ministère a fait cette demande et l'avis a été donné, mais en plus de ça, le Sénégal a souscrit à l'initiative ECOVAX, ce qui lui permet de profiter de ce plateau international. Vous avancez. Ce qu'il faudrait aussi toujours préciser dans cette logique, c'est que l'objectif ECOVAX, je ne pense pas. Allô, vous me recevez apparemment Allô, vous me recevez?
Oui, nous vous recevons très bien.
Merci beaucoup. Donc, ce qu'il faudrait préciser, c'est que l'initiative ECOVAX, c'est une initiative supranationale. Et cette initiative de l'ECOVAX, madame qui présente tout à l'heure l'a évoqué, je n'ai pas besoin d'y revenir, est parfaitement en phase avec la réglementation sénégalaise. Et l'État du Sénégal, donc, peut bel et bien procéder à une acquisition directe dans le cadre de ses initiatives ECOVAX, mais aussi dans le cadre de son partenariat multilatéral. Cependant, puisque cette pandémie est une maladie qui n'est pas encore prête à quitter nos eaux pour le moment, on a aussi la possibilité d'autres modes de passation des marchés publics. Et parmi ces modes de passation des marchés publics, nous avons la possibilité de lancer un appel d'offres ouvert en respectant les principes de passation des marchés publics. Cependant, ce qu'on constate, c'est que par rapport à la fabrication des vaccins, c'est des firmes spécialisées qui ont l'autorisation ou l'habilitation de l'OMC, ce qui induit que nous ne sommes pas dans des conditions nécessaires pour aller vers l'appel d'offres international ouvert. On peut bel et bien aller vers un appel d'offres restreint, c'est-à-dire identifier ces différentes firmes qui fabriquent ces vaccins et organiser une compétition dans le cadre d'une procédure d'appel d'offres restreint. Donc, c'est des possibilités qui sont offertes par la réglementation sénégalaise. De la même manière aussi, la réglementation sénégalaise donne la possibilité à l'État de pouvoir engager une procédure entente directe. Les conditions de la procédure de l'entente directe sont prévues par l'article 76 du Code des marchés publics. C'est lorsque nous sommes dans le cadre d'une situation d'exclusivité. Cela veut dire quoi? Lorsque le vaccin est fabriqué par une seule entreprise, cette entreprise-là, pour qu'on puisse acquérir les vaccins là concernant, l'État a la possibilité de conclure une entente directe. Et de ce point de vue, le ministère de la Santé demande seulement l'autorisation de la DCMP qui puisse accéder. L'autre dimension, c'est que s'il y a beaucoup d'entreprises qui fabriquent le vaccin et qu'il y a une urgence immédiate, et de ce point de vue aussi, le ministère de la Santé peut demander l'autorisation de la direction centrale des marchés publics, laquelle autorisation va permettre effectivement de procéder à une acquisition compte tenu de l'urgence. S'il y a maintenant difficulté, si aujourd'hui nous étions dans des circonstances où la DCMP aurait pensé que l'État avait suffisamment de temps de planifier, là, le dernier recours, c'est l'autorité de régulation des marchés publics. Donc, en définitive, ce qu'il faudrait retenir pour le cas du Sénégal, c'est que le Sénégal, dans le cadre de l'acquisition des vaccins, a principalement deux possibilités. Une possibilité de procéder par une contractualisation exceptionnelle, c'est-à-dire faire une entente directe avec le partenaire, ou bien lancer un appel d'offres restreint entre les différentes entreprises qui sont autorisées par l'OMC, ou bien procéder par une procédure d'appel d'offres ouvert. De la même manière aussi, ça, c'est ce que nous offre le droit national. De la même manière, lorsque ces médicaments-là sont identifiés comme étant sur la liste des médicaments d'urgence, le ministère de la Santé peut avoir l'autorisation de l'ARMP pour procéder à une contractualisation directe. Ce qui a été le cas récemment, le ministère de la Santé a soumis une liste de médicaments pour lutter contre la COVID-19, pour demander l'autorisation, l'avis de l'ARMP conformément au code des marchés publics. Et l'ARMP a donné son avis favorable pour qu'il puisse procéder à une acquisition directe. L'autre dimension, c'est la suprématie des conventions internationales et des conventions de financement. Dans le cadre de l'initiative ECOVAX, puisque c'est une convention supranationale, les prescriptions de l'ECOVAX s'imposent sur le droit national et en conséquence, l'État peut valablement souscrire sur la base des engagements pris dans le cadre de l'ECOVAX. Voilà de manière résumée ce que j'ai voulu partager avec vous par rapport à la réglementation sénégalaise sur l'acquisition des médicaments dans le cadre de la COVID-19. Étant entendu que le premier exposant a largement revenu sur la définition de l'ECOVAX et les avantages que ça offre aux différents États. Merci beaucoup.
Merci, Dr Diop, pour cette excellente et succincte présentation justement sur l'expérience du Sénégal dans le recours à la plateforme COVAX pour l'obtention des vaccins, et aussi vous avez un peu touché du doigt les ajustements en matière de passation de marché qui ont été mis en place au niveau du Sénégal. Nous allons revenir pour justement comprendre de plus en plus votre expérience dans ce sens. Mais avant tout, j'aimerais d'abord revenir sur une question qui a été posée par M. Amos de l'OMS à l'endroit de Mme Ifepe pour savoir justement comment est-ce que l'AMSP a traité les questions de réglementation nationale, surtout en matière de prépaiement, ainsi que sur les lois en matière d'approvisionnement des pays individuels. Je pense que cette question tourne un peu autour de comment est-ce que votre plateforme, Madame Ifepe, a intégré les considérations vraiment internes en matière de réglementation et de prépaiement dans justement la mise en œuvre de votre mécanisme.
Thank you. While I can't get into the specifics of the financing terms, what I can share is, Mr. Amos, that one of the things that have been considered, and this is after multiple conversations with the Bureau of Presidents at the level of the African Union, was we had adapted a little bit specifics from each country. So it's a forum. So AVAT is made up of, African Union Ministers of Health. There are some countries whose Ministers of Health are part of AVAT. And so that platform offers a lot of ideas exchange. So the financing terms that had been drafted is a little bit of a mix and match that had taken into consideration some procurement acts from multiple countries. while the contract and where we find ourselves is a bit of a unique experience that the African Union hasn't had to manage before, what we are doing is, with the generic framework that has been established, we are going to each country before they sign their contracts. I mean, they have to review and accept some of the terms that have already been drafted. The good bit is the COVAX agreements and contracts were concluded. And I mean, because this AVAT process, it's a complementary effort to what COVAX has. There's a lot, so we also try to adapt with what countries are familiar with, right? So COVAX contracts, the same methodology with what COVAX had signed with, participating member states, so that there are just few differences from country to country. Basically, in summary, what I'm saying is, while the financing terms is something I can't delve into, what I can share is that there's been a lot of similarities around what had already been established on the COVAX side to what the AVAT is doing, because what AVAT has been set up to do is to complement the COVAX and the donor organizations' efforts, and not to start up a new process altogether. Thank you.
Merci, Madame Ifebe. Réponse très claire. Et je pense que l'une des leçons qu'on peut retenir, c'est qu'il y a vraiment une sorte de similarité entre les outils et les mécanismes employés par le COVAX et votre initiative. J'aimerais me tourner maintenant vers Monsieur Samba pour lui poser une question justement qui nous est venue par chat de ma collègue Danielle, qui soulève le fait que vous avez mentionné précédemment que malgré la mise en place de protocoles séparés en matière d'approvisionnement d'urgence, notamment à travers la COVID-19, y compris aussi en matière de passation de marché direct, il y a le gouvernement du Sénégal qui s'est justement appuyé sur des pratiques d'approvisionnement préexistantes, telles que les appels d'offres, ainsi de suite. Donc, la question est de savoir pourquoi est-ce que vous pensez qu'il y a eu une sorte de réticence pour s'écarter des processus habituels, et qu'est-ce qu'on peut faire, en tout cas en matière de processus et en matière d'expérience que vous pouvez nous partager, qu'est-ce qu'on peut faire pour rassurer les fonctionnaires des administrations publiques, notamment les autorités contractantes, pour qu'elles puissent justement utiliser les processus déjà existants au sein de votre administration?
Merci beaucoup. Les procédures, vous savez, le Code des marchés publics dans nos pays pose les principes de l'appel d'offres ouvert pour les questions de transparence. Mais les principes qui seront le système de passation des marchés publics, c'est le principe de transparence, le principe d'égal traitement, le principe d'une concurrence, mais aussi le principe d'efficacité. Et parfois, sur ces différents principes, il faudra procéder à des arbitrages. C'est ce qui justifie les procédures de droit commun et les procédures dérogatoires. Le principe, c'est une procédure d'appel d'offres ouvert. Mais on sait très bien que pour l'acquisition de vaccins, même s'il n'y avait pas l'initiative de COVAX, ce principe ne paraît inadapté par rapport au contexte mondial de l'acquisition des vaccins. Pourquoi? Parce que c'est une liste limitativement énumérée et identifiée de firmes qui ont l'onction de l'OMC pour livrer les vaccins. Et ces firmes-là, il n'est même pas certain que si vous organisez un appel d'offres ouvert, ces firmes vont se bousculer. Il n'est même pas certain, peut-être par contre, si vous organisez un appel d'offres restreint, tu as relativement de chances que ces firmes acceptent de venir. Ça dépend de la demande mondiale. Aujourd'hui, s'il y a assez de clients qui sont prêts à venir faire une contractation directe auprès de ces firmes ne vont pas aller compétir, même si c'est un appel d'offres restreint. Donc, de ce point de vue, on a permis une ouverture à ce que l'autorité contractante, notamment le ministère de la Santé, puisse faire effectivement une entente directe pour acquérir ces médicaments, même si nous étions seulement dans l'initiative nationale sans passer par l'initiative ECOVAX. Ça, c'est le premier niveau. Maintenant, le second niveau, c'est le niveau des initiatives multilatérales, telles que l'initiative ECOVAX et les partenariats avec les autres pays tels que la Chine. Ces conventions supranationales ont une valeur supérieure aux normes nationales. Et en conséquence, les prescriptions de l'ECOVAX permettent à l'État, notamment le ministère de la Santé, de procéder à des acquisitions directes pourvu que ces acquisitions-là soient conformes aux prescriptions de l'initiative ECOVAX. Ça, c'est ce qu'il faudrait. Donc, vraiment, la réglementation actuelle ne fait pas obstacle à une acquisition efficace de ces médicaments. Cependant, ce qu'il faudrait retenir, si l'acquisition peut être très flexible, il faudra comprendre qu'à posteriori, il y aura un audit. On va procéder effectivement à auditer toutes ces acquisitions-là pour vérifier est-ce que l'acquisition a été faite conformément aux pressions de l'ECOVAX, est-ce que ce qui a été commandé a été effectivement livré, et tous ces éléments-là feront l'objet de vérification à posteriori à travers les missions d'audit au niveau de l'organe de régulation. Merci beaucoup.
Merci, monsieur Dr Diop. Peut-être nous allons rester avec vous justement pour une question et un aspect qui n'a pas vraiment été très mis en avant jusqu'ici. C'est l'aspect justement de la transparence et de la redevabilité. Je pense que nous avons lancé un rapport récent qui a documenté l'expérience du Sénégal dans ce sens, mais ce serait intéressant aussi d'y revenir aujourd'hui. Est-ce que vous pouvez nous partager un peu votre expérience au niveau de l'autorité de régulation en matière de support aux autres autorités contractantes sur les procédures et les processus qui ont été mis en place pour justement garantir la transparence et aussi la célérité dans l'exécution des procédures et des contrats liés aux achats des aspects liés au COVID-19, que ce soit des vaccins ou des médicaments ou d'autres aspects qui ont été induits et impliqués dans le combat contre cette pandémie jusqu'ici.
Merci beaucoup. Ce qu'il faudrait comprendre, c'est que l'organe de régulation des marchés publics, contrairement à un discours très répandu, est moins un gendarme des marchés publics qu'un assistant des acteurs du système des marchés publics. L'organe se positionne comme étant un assistant qui accompagne non seulement le secteur privé, mais aussi le secteur public, pourvu qu'on puisse respecter les principes sacro-saints qui sous-tendent le système. Et de ce point de vue, durant la période du Covid, à plusieurs reprises, le CRD d'abord a sorti un avis pour permettre qu'on puisse procéder à l'ouverture des plis dans le respect des mesures barrières. Et aujourd'hui, les séances d'ouverture des plis se faisaient de manière publique en présent tous les candidats. En vertu du principe de distanciation sociale, on a permis à ce qu'on puisse procéder à l'ouverture fermée en informant les autres, tout en donnant la faculté pour les entités qui ont la possibilité de faire une ouverture digitale pour permettre aux autres de procéder à l'ouverture en ligne, ce qui suppose bien sûr effectivement un dispositif technologique. L'autre dimension, c'est que très souvent, des autorisations ont été introduites au niveau de la RMP pour solliciter des dérogations pour faire une acquisition directe dans le cadre de la COVID. Toutes ces dérogations-là ont été accordées vraiment durant cette période, que si l'acquisition est analysée et entre dans le champ de la COVID-19, on vous autorise. Par contre, on a vu d'autres entités qui ont voulu profiter du contexte pour y mettre des choses qui n'ont rien à voir avec les actions de la COVID-19. Les acquisitions liées aux intrants agricoles, non, je suis désolé, n'ont rien à voir avec la COVID-19. Vous pouvez me dire, je veux acquérir des denrées alimentaires pour venir en aide les populations qui sont tenues d'être en confinement. Je veux acheter, je veux assurer la restauration des médecins. Je veux acquérir des équipements destinés effectivement aux médicaments ou bien aux structures hospitalières. Là, on vous autorise. En dehors de ces éléments-là, on vous demande de respecter les procédures classiques. En plus de ça, on a permis, surtout dans le cadre de la COVID-19, des contentieux qui ont été éclatés où il y avait une obligation de respecter les délais. On a autorisé à ce qu'on prolonge les délais compte tenu de l'impact apporté par la COVID-19. Donc, c'est ça le dispositif. À chaque fois qu'on est saisi, on a apporté une assistance. On a même sorti récemment un avis pour permettre au ministère de la Santé de procéder à des actions directes sur tout ce qui concerne les médicaments qui sont liés à la COVID-19, donc y compris, bien sûr, ces vaccins. Cependant, ça, c'est en amont. Mais en aval, toutes ces procédures seront auditées pour vérifier est-ce que les quantités qui ont été déclarées comme acquises ont été bel et bien livrées et quelle est la preuve de livraison. Même dans l'exécution, on va vérifier est-ce que ces médicaments-là, conformément au protocole décliné par le comité Force COVID-19, ont été destinés aux populations prioritaires conformément aux engagements qui sont pris par des autorités publiques. Et tous ces éléments-là feront l'objet de publication sur le portail des marchés publics. Si vous allez sur le site des marchés publics, vous allez voir toutes ces décisions dont je vous parle, tous ces avis et tous ces rapports qui concernent les autres contratantes. Merci beaucoup.
Merci, Dr. Diop, pour ce partage très intéressant, justement, sur les garde-fous qui ont été implémentés en matière de redevabilité et de transparence. J'aimerais me tourner à nouveau vers Madame Ifepe pour une question qui a été posée par un participant, notamment Wei Oniap. J'espère que je prononce bien le nom. Et la question tourne autour, en fait, des défis que posent les achats groupés, notamment avec l'initiative COVAX et votre initiative AVAT, justement en raison du manque de transparence imposé par les fabricants en matière notamment de prix et aussi de calendrier de livraison et même en matière de redevabilité. Et de votre expérience à travers la nouvelle plateforme, comment cela vous affecte? Comment cela affecte les initiatives de l'AVAT et quelles sont les solutions que vous pouvez justement proposer pour pallier à ces différents défis?
Thank you. So there are a few things that have happened. And I think with COVAX already commencing deliveries, it's provided us with a lot of opportunities to identify ways to kind of mitigate on the risk that have currently, that we currently see. For example, around transparency of pricing. I mean, this is a big issue, but because we already knew that this was something that was sort of, that was identified as a problem, again, we really did leverage the work that had already been done by COVAX. I mean, there's bits and pieces of those conversations that we went into legal meetings saying we won't take anything less than XYZ. So we were fortunate that there's already been enough work that had been done, whether it's by the COVAX contracts or with bilateral agreements that countries had done. So we had a very firm idea around costs across the globe for the different vaccine manufacturers. Again, I'm really just starting off with the pricing transparency bit. So we went in armed with a lot of, this information. We knew who was charging which country what. So it put us in a better, place to kind of negotiate. I'm not saying we completely mitigated all of the risk, because even internally, when we have some of these discussions and we hear about countries that were charged higher than what we were offered, we will still go back to offer to those countries that, hey, AMSP under the African Union and with AVAT, they can help you. So, I mean, there's just no one way, there's no one solution right now. We are just rolling with the punches as we go. Regarding delivery schedule, this is still a very big topic. And again, we see it with the delays on the COVAX side. So we anticipate that with this global supply constraint, it is going to be a problem up until maybe September, right? So we know that countries in the West, the US, the UK, they're targeting to complete a huge chunk of their population by summer. So we know also that by summer, early August, there might be a lot more, vaccine mixes in the pool. So we know that there's going to be, I mean, Novavax is there. There's just going to be a lot of options provided to us. So in terms of like delivery schedules, supply constraints, we anticipate, and I mean, this might be premature, but we do anticipate that they will start easing up. And so we might be able to access some of these vaccines in a more timely manner than what we've been experiencing so far. And again, it's not because we're doing anything specific, it's just timing in the market. So I mean, that's really what I'd say, right? So there's no magic we're doing differently. We're looking at what has happened. We're trying to mitigate some of the risks as much as possible. But because this is a global vaccination or a global immunization effort happening across the world, there's only so much we can, fight to mitigate. Some of them we are rolling with the punches. Thank you.
Merci beaucoup, Madame Ifepe, pour cette réponse. Peut-être je vais rester avec vous pour une question que je trouve particulièrement intéressante, justement, quand on prend le contexte récent de l'efficacité, du débat autour de l'efficacité des vaccins. On a eu le cas en Afrique du Sud et dans d'autres pays, notamment avec le vaccin AstraZeneca. La question est de savoir comment est-ce que vous faites justement pour aider les pays à naviguer autour des incertitudes qui entourent l'efficacité et les risques des différents vaccins au niveau de votre structure.
So we are fortunate to have the African CDC experts, consulting daily on this, and they are the ones issuing guidelines, that are applicable for the African continent. And we rely on them, honestly, because we are just e-commerce retail experts here. The scientists are the ones that are advising on which vaccines we should go forward with, which vaccines we should shy away from. And for example, with AstraZeneca, what had been released when there was the heightened fear around blood clots it was recommended for countries to still continue using it because it offered a lot more advantages than disadvantages. Anybody who is sick today will prefer to be sick than to die. So the vaccines, once you get immunized, at least it protects you from hospitalization or at most severe cases of infection. So what the African CDC's guidelines recommend is what we would typically follow. All of us followed regulations and advice from WHO, from, for example, Europe Medicines Agency, FDA. We will all look at that. But as our North Star on the continent, we rely on the African CDC and we follow some of the guidelines that they've set up for us. So based on that, the engagement with the countries are also utilized using those guidelines. What we've realized is, Africa has incredible amount of bright minds. So when you're even interacting with some of the countries who happen to be also part of the regulatory efforts that had been put in place at the start of the year by the African CDC to fast track approvals of vaccine in countries, you realize that they are also in parallel having this kind of dialogue around efficacies with not just the African CDC, but with counterparts at the level of the WHO. So the conversations are pretty similar and in tandem. We are following, the North Star African CDC, recommendations from WHO, etc. So there's nothing unique that we're doing around that. We are just sticking with what the scientists are recommending and we're shying away from sensational headlines. Thank you.
Excellent, very clear. Peut-être la même question, mais sur un angle un peu plus, on va dire, contextuel du pays. À vous, Dr. Diop, c'est la même question. Comment est-ce que justement l'efficacité des différents vaccins a été pris en compte dans le processus d'achat? Si est-ce que vous pouvez nous donner des informations dans ce sens, et aussi quel a été le niveau de collaboration avec les agences de régulation des médicaments et des vaccins au niveau du Sénégal. Quelle est votre expérience dans ce sens?
Merci beaucoup. Au Sénégal, il faudrait relever que dans le cadre de la COVID-19, l'État a mis en place un dispositif spécial dirigé par un officier de l'armée qui est la force COVID-19. Et c'est dans ce cadre qu'intervient effectivement les acteurs du secteur médical, y compris la pharmacie nationale d'approvisionnement, pour s'assurer que les vaccins puissent exister. Et ces vaccins-là, effectivement, on avait décidé d'abord de vacciner de manière prioritaire les membres du corps médical, les médecins et le personnel soignant. Ensuite, on a intégré les personnes âgées et les personnes qui ont des comorbidités. Aujourd'hui, maintenant, on l'a élargi à toute la population. Et il y a aussi un dispositif de suivi de l'efficacité. Pour ceux qui avaient pris leur première dose, il y a un dispositif d'alerte par SMS. Les gens s'inscrivent sur une plateforme en ligne et on les alerte qu'ils doivent passer pour procéder à la seconde dose. Et une fois maintenant que les personnes subissent le vaccin, il y a un suivi qui est observé pour voir les effets éventuels. Maintenant, cette information-là est sensible. Les acteurs du secteur médical le gèrent et le traitent. Mais si vous décidez de voir à chaque fois que quelqu'un a subi des effets négatifs qui sont plus ou moins attribués à ce vaccin-là, vous ne pouvez pas faire une communication publique au point d'apeurer les gens. Comme l'a dit tout à l'heure l'intervenante, les gens préfèrent être malades que mourir. Une maladie, il y a une possibilité de la soigner, mais la mort n'est pas soignable. Et en conséquence, les effets néfastes, les effets qui auraient été constatés, et malheureusement, ou heureusement jusqu'à présent, au moment où nous parlons au Sénégal, c'est des éléments qui sont extrêmement marginaux. Mais pour la plupart des cas, on n'a pas encore eu quand même des retours négatifs qui sont liés à l'usage de ce vaccin. Mais tout compte fait, il y a un dispositif de suivi pour apporter les correctifs nécessaires. Et ça, l'État a choisi effectivement d'avoir comme des relais les acteurs de la société civile, les dignitaires religieux. On a vu des marabouts. Au Sénégal, les marabouts sont très puissants. Les marabouts, ce sont les chefs de confrérie qui non seulement sont en première ligne pour d'abord recevoir leur dose de vaccin. On a vu aussi les lutteurs. Au Sénégal, le sport le plus prisé, c'est la lutte. On a vu d'abord les lutteurs accepter de se faire soigner, même s'ils ne faisaient pas partie des personnes qui vivaient avec des maladies. Mais on les a privilégiés pour donner quand même confiance à la population. Et les premières personnes qui se sont vaccinées, c'est d'abord le ministère de la Santé, les membres de la force COVID-19, à la tête desquels les médecins, et même le président de la République et l'ensemble des différents ministres. Voilà donc ce que donc il y a une coalition vraiment, une coordination nationale pour encourager les gens à faire le vaccin, mais aussi un dispositif très efficace par rapport au suivi. Mais sur ces éléments d'information, le suivi, lorsqu'il y a des dysfonctionnements, les acteurs du secteur médical apportent des corrections, mais n'en fassent pas une communication qui puisse saper ou parasiter la communication, la sensibilisation sur la vaccination. Merci.
Merci, Dr Diop. Très intéressant. Je pense qu'on retient que au niveau scientifique, il y a la pharmacie nationale et un ordre d'experts médicaux qui est impliqué justement dans les analyses de ces vaccins. Et il y a aussi une forte communication autour avec justement l'implication des acteurs les plus en vue, notamment les leaders de la société civile et même des grands noms du pays pour se faire vacciner d'abord en vue de rassurer la population sur l'efficacité de ces vaccins. Nous avons juste quelques minutes avant de conclure et c'est l'opportunité pour moi d'avoir vos mots de fin, mais en même temps de se projeter un peu sur l'avenir et de nous dire au niveau de vos deux structures, pour vous, quelles sont, si vous devez retenir peut-être 2 leçons les plus importantes en matière justement d'initiatives AVAT et aussi au niveau du Sénégal dans l'utilisation des plateformes d'achat de vaccins communes. Quelles sont les 2 leçons principales que vous pouvez nous partager ici et aussi comment est-ce que vous voyez l'avenir en matière de challenge à venir?
Merci beaucoup. Les 2 leçons principales que nous avons retenues est qu'aujourd'hui nous sommes dans la mondialisation. La meilleure manière de vivre, c'est d'accepter de vivre dans cette mondialisation et d'avoir des initiatives concertées comme COVAX. Ça, c'est la première chose. La seconde chose est qu'effectivement, l'État doit augmenter le budget d'investissement dans la recherche et le développement et accompagner les scientifiques au niveau national et les firmes pour qu'on puisse procéder non seulement à la fabrication de vaccins, comme l'a annoncé le président de la République hier, mais en plus du vaccin, que l'essentiel des médicaments quand même puissent être fabriqués au Sénégal. Je pense que ce sont les 2 grandes leçons qu'on peut retenir. D'abord, sur la question de continuer la coopération internationale dans des liens comme ECOVAX, mais aussi d'engager un processus pour quand même la fabrication locale, non seulement de ces vaccins et tous les médicaments en matière de COVID-19. Plus généralement, on a compris que, compte tenu des priorités d'investissement, les investissements en matière d'infrastructures sociales, notamment sanitaires et d'équipements, n'ont pas été à la hauteur de la mission. Nos pays se sont précipités à financer les grandes infrastructures routières. Et aujourd'hui, effectivement, les émeutes de mars 2021 au Sénégal, suite à la tentative d'arrestation de Ousmane Sonko, ont permis, qui est un leader politique au Sénégal, ont permis à l'État de se rendre compte que son investissement sur les questions sociales, notamment les questions de santé publique, les questions de l'emploi des jeunes, ces investissements-là méritent d'être fouettés, et c'est le cas spécifique de la question de ces vaccins qui, certes, nous impose à accepter la coopération internationale, mais d'encourager des initiatives pour une fabrication locale. Vraiment, vivement l'existence d'industries pharmaceutiques fortes au niveau national. Merci.
Excellent. Madame Chidima, qu'est-ce que vous pouvez nous dire en tant que maison et aussi dans l'avenir, quels sont les challenges auxquels vous pensez que vous pourrez faire face avant de conclure?
So for me, one of the big lessons is as a continent, our reliance on Western support is really, it's crippling. So imagine we are still talking about kicking off in some areas the vaccination drive, while in the West, some countries are talking about completing the vaccination of their citizens. So there's never been a time where the starking lack of manufacturing progress on the continent has been made clear. We are fortunate that Aspen in South Africa will be doing a lot of the manufacturing of the Johnson & Johnson vaccines on the continent, but there's still a massive opportunity when it comes to pharmaceutical manufacturing capacity for the continent. I mean, we are the same size on the continent as India, but India, they have Serum Institute, and they even have the guys that are producing COVID vaccine. So they have a lot of manufacturing capacity that can support their own country if they were ever cut off from the global supply chain. On the continent, we have institutes like the Institut Pasteur in Senegal. We have capacity in Egypt. We have opportunities in the East, in the West, but we haven't really come together to be able to do something at a grand scale to support our own vaccine requirements. And there have been a lot of wake-up calls that have been directed at this kind of lack of manufacturing progress on the continent. But our sincere hope is that if we learn anything, is we learn that we need to start pushing on the manufacturing structure when it comes to pharmaceuticals companies on the continent. I think that's one of the biggest lessons that it kind of rings every time I think about the pandemic. But one other really good thing I would say that has come out of the pandemic is, again, AMSP is really it's a very young entity that started in June 2020. But one thing that continuously surprises me is how much value, we can get as a continent when we use the power of our numbers. Pool procurement, we've seen it in whether it's the UNICEF pool structures, UNDP, WHO. We've seen it across the board before, but it is still amazing how, despite that we have pool procurement mechanisms that have existed for decades, we are still able to plug in some of the gaps that we see with another pool procurement mechanism. So it really begs the question of, we need to develop some sort of synergy across the board when it comes to thinking through regional pool procurement mechanisms. And I think one of the lessons is they really cannot be enough. When we are faced with medical scares of this nature, we need to be able to leverage every single resources existing to us to be able to address some of the gaps and mitigate some of the health risks that are currently prevalent on the continent. So I think that those would be like my two lessons and challenges I'd like to really leave the group with today.
Merci.
Thank you.
Merci beaucoup, Madame Ifepe, et merci aussi, Dr. Diop, pour votre présence et votre présentation sur l'expérience du Sénégal dans le financement des vaccins à travers la plateforme COVAX, et aussi sur d'autres initiatives qui sont en cours en matière de justement passation de marché. Nous venons justement, nous sommes à la fin de cette session qui fut très dynamique avec beaucoup de leçons, beaucoup d'expériences. Et juste aussi vous rappeler, et ma collègue Daniel l'a mis dans le chat, que nous avons justement documenté cette expérience en matière de passation de marché, aussi en matière de transparence et de redevabilité dans un document de travail qui est disponible en consultation publique sur notre site web. Donc, n'hésitez pas à repartir sur le site, le hub de Capri et télécharger les rapports, les rapports concernés. Merci encore une fois et je reviens vers toi, Daniel, pour la suite.
Thanks so much, Regis. Yeah, great session. Thank you. Just to note that that report on emergency procurement is already on the website, so you can download it at the link that I shared. So we're going to take a 10-minute break now and come back at 11:30 GMT +2. And during that, I'm going to relaunch the poll. It wasn't particularly well answered. Hopefully we get a few more answers during the break. And then we'll come back to session 6, looking at the vaccine rollout. So 9 minutes from now, I'll see you back here. Thanks so much.
Merci beaucoup.
Hi everyone, hope you had a chance to stretch your legs and get some coffee. We're gonna start session 6 soon. Hey Binyam, which Binyam, my colleague, will be facilitating, and yeah, over to you, that's it.
Thanks, Daniel. My name is Binyam Bedasso from the Cabri Secretariat. So we've arrived at the last session of the workshop. So over the last 2 days, we've covered a range of issues from financing, budgeting to procurement, and the last session is about rollout. So that's the challenge many countries are grappling with currently. And it's about getting vaccines from the central warehouse to people's arms. And that's arguably the most challenging last mile of the distribution chain. And it's often the most expensive. Yesterday, one of the panelists pointed out that the vaccines that are purchased for $1 to $2 might cost $5 to $6 at the end of the day when the back end cost is included. So it's very complex and it might be expensive. And it's really what matters in terms of effectively rolling out and delivering the vaccines. And then Africa is not really doing well in terms of preparation for the rollout. So according to the WHO vaccine readiness assessment tool, Africa has, the continent overall has only 33% readiness, which is much lower than the benchmark 80% readiness required. And the rollout phase also has implications for equity, within countries, and there might be some vulnerable groups and vulnerable areas that might not be reached easily, and that has significant implications for equity. So this is a very important topic, and we are joined by two speakers to talk to us about this issue. First will be Dr. Helen Barra from the World Health Organization, and she will be talking to us about the findings of the scoping review on PFM and vaccine rollout her organization has conducted. It will be in French, and she'll have between 15 and 17 minutes to present. And that will be followed by the presentation by Dr. Bakunawa Garba Bello from Nigeria, from the National Primary Healthcare Development Agency, and he'll be talking to us about the planning for the COVID-19 vaccination program rollout in Nigeria. And then that will be followed by a Q&A session of about 25-30 minutes. So first will be Dr. Helen. Dr. Helen, over to you.
Okay, hello, good morning everyone, good afternoon everyone. So yeah, I've been asked to do this presentation in English, so in French, sorry. So I'll switch to French in a minute, but I'll be happy to take questions in French, but also in English after the presentation or during the discussion session. Ok, donc je vais parler en français. Je travaille à l'Organisation mondiale de la santé. Je suis en charge des questions de gestion des finances publiques pour le domaine de la santé. Et dans cette présentation ce matin, je vais me focaliser sur les liens qui existent entre la gestion des finances publiques et la vaccination contre la COVID. On m'a demandé de faire une présentation relativement réduite, autour de 5-6 diapositives, pour vraiment permettre une discussion et une session interactive pour ce domaine qui est très important. Et donc, j'espère qu'on pourra avoir la discussion après, comme ça a été le cas pour la session sur le procurement. Donc, tout d'abord, je voudrais commencer en fait cette présentation par remettre un petit peu dans le contexte de notre discussion la question du financement de la réponse à la Covid. Donc, on sait que, et on l'a vu hier notamment, la réponse santé à la Covid 2019 dépend largement du financement public. D'accord ? Tous les pays, on l'a vu, ont adopté des allocations budgétaires exceptionnelles pour répondre à la Covid. Et sur cette diapositive, je rapporte simplement des données qui ont été collectées par l'OMS en décembre 2020 qui montrent en fait le niveau d'allocation budgétaire par tête pour l'année 2020, donc avant le déploiement des plans de vaccination. Donc, le niveau d'allocation budgétaire par groupe de revenus et par niveau d'allocation par tête. Simplement pour montrer que, quel que soit le niveau de revenu, l'ensemble des pays, cette étude concerne 113 pays, mais c'est valable pour quasiment l'entièreté des pays du monde. L'entièreté des pays du monde a donc augmenté ses ressources publiques pour répondre au Covid, et c'est une réponse qui est demeurée largement financée par des fonds publics. On voit que des financements privés ont pu être apportés à la réponse, mais que globalement, en pourcentage, en proportion, il reste plus relativement marginal par rapport au financement prédominant du secteur, par le secteur public. Et donc, c'est vraiment dans ce contexte de financement public que l'on voit que l'interaction avec les mécanismes de gestion des finances publiques, PFM, for the translation, on voit que donc l'interaction avec les mécanismes de gestion des finances publiques est très importante. Et ce, je dirais, à chacun des stades du cycle budgétaire, donc de la formulation des budgets jusqu'à leur exécution et enfin leur suivi. Ce qu'on a vu à travers notre travail et le travail d'autres collègues, en particulier dans la phase, je dirais, avant la mise en place de la vaccination, c'est qu'en général, les pays, beaucoup de pays, dans la région Afrique, mais aussi au-delà, ont rencontré un certain nombre de problèmes, de faiblesses au sein de leur système de gestion des finances publiques pour la réponse au Covid. Et ces problèmes étaient aux trois niveaux, je dirais, du cycle budgétaire. Tout d'abord, on a vu dans les pays un certain nombre de rigidités dans la manière dans laquelle les budgets étaient formulés, qui ont parfois empêché des reprogrammations rapides en faveur de la réponse vers le Covid. D'accord ? Donc, un certain nombre de rigidités, notamment liées à des budgets qui étaient formulés par input, par intrant, qui créent des défis pour rediriger en fait la dépense de manière appropriée vers la réponse Covid. Deuxième chose qu'on a observée de manière systématique dans les pays, c'est que les modalités de dépenses, les procédures de dépenses étaient parfois compliquées et ont pu retarder et empêcher une dépense effective en faveur de la réponse Covid. Notamment, dans ce cadre-là, les fournisseurs de soins ont parfois, dans certains États, peu ou pas accès aux fonds et aux fonds Covid dans ce cas-là. Et ça a été un défi. Ces fonds sont parfois reçus et managés par des niveaux supérieurs et les fournisseurs de soins n'ont pas accès à ces fonds. Et donc ça a été aussi un problème que l'on a vu dans le cadre du Covid. Le dernier point, on en a déjà parlé, les systèmes de rapportage et de monitoring du budget sont parfois faibles, sont fragmentés dans le secteur de la santé, comme on le sait. Et dans le cas du Covid, ça a créé des défis en termes de redevabilité. Donc voilà, je voulais simplement remettre le contexte en place et bien partager avec vous pourquoi nous pensons que la gestion des finances publiques et ces mécanismes sont vraiment une question fondamentale pour la réponse au Covid. Et donc, afin de regarder plus en profondeur ces questions de gestion des finances publiques, à l'OMS, on a réalisé un certain nombre d'études depuis mars 2020 ou février 2020, depuis le début de l'épidémie. On a fait une enquête, un questionnaire sur les modalités PFM pour la réponse au Covid, On a publié les résultats conjointement avec la Banque mondiale, je vous donnerai les références après. Troisième point, je passe rapidement sur la revue des allocations budgétaires dont j'ai déjà dit un mot précédemment en introduction. Troisième point, on a fait une analyse des caractéristiques en fait, des fonds extra-budgétaires qui ont été mis en place pour la réponse au Covid. Cette analyse a été faite conjointement avec le FMI pour vraiment montrer le pour et le contre de ce type d'approche. Et aujourd'hui, ce qui nous intéresse plus particulièrement, c'est qu'on est en train de faire une étude sur un peu les points de pression des systèmes de gestion des finances publiques pour le déploiement. Donc, c'est vraiment ces réflexions-là que je vais partager avec vous dans les prochaines diapositives. Can we mute? Thank you. Donc déjà partager avec vous une remarque générale qui ressort de ce travail, c'est qu'on note que le déploiement de la vaccination pour la Covid se heurte, en fait, si vous voulez, au même goulot d'étranglement de gestion des finances publiques que la dépense de santé régulière, si je peux parler ainsi. Donc, on voit que ce que j'ai mentionné précédemment, des budgets qui n'offrent pas une très grande flexibilité, des modalités de dépenses qui sont compliquées, tout ça, bien entendu, ça affecte la délivrance du vaccin. Mais on sait aussi que la délivrance du vaccin va se heurter à un certain nombre de goulots d'étranglement qui sont plus spécifiques à la vaccination. D'accord ? Et j'y reviendrai dans un instant. Ce qu'on note aussi par rapport à ce constat, c'est que, et je crois qu'on l'a vu encore hier, c'est qu'en général, ces défis sont peu connus en fait, principalement par les acteurs de santé, et ce n'est pas quelque chose auquel on pense systématiquement, notamment quand on fait les plans de déploiement. D'accord ? On pense souvent à combien, on a vu les problèmes d'estimation des coûts hier, et comment intégrer ces coûts dans les plans budgétaires. Mais on pense moins souvent à comment en fait les modalités de gestion des finances publiques vont en fait affecter vraiment la délivrance du vaccin jusqu'aux premières lignes, jusqu'au dernier niveau ou comme on dit en anglais the last mile, d'accord ? Donc en fait comment ces fonds vont arriver jusqu'aux fournisseurs de soins, comment ça va les empêcher ou pas de délivrer une vaccination de manière effective. Donc pour cette raison, on souhaitait vraiment avoir cette présentation ce matin pour augmenter, je dirais, la compréhension et la conscience vis-à-vis de ces problèmes. Dans cette diapositive, je vais en fait partager avec vous un tour d'horizon des principaux problèmes de gestion des finances publiques qu'on a identifiés pour la vaccination. Je vais différencier les problèmes liés à la formulation du budget d'un côté et de l'autre côté, les problèmes liés à l'exécution du budget. Hier, on a déjà parlé avec les différents intervenants des problèmes d'estimation de coûts, donc c'est mon premier point ici, aussi de planification budgétaire à court ou moyen terme. Okay, donc je vais cibler mes inputs maintenant sur deux questions supplémentaires qui sont la structure des budgets et la question des détenteurs du budget, parce qu'on a moins parlé de ces problèmes hier. Donc première question, la structure des budgets. Souvent, ce qui se passe dans un certain nombre de pays, notamment sur le continent, c'est que les budgets continuent à être formulés par intrants. Et on a vu ça précédemment, notamment avec des travaux de l'OMS et aussi beaucoup de l'UNICEF, c'est que pour la vaccination, pas forcément la vaccination Covid, mais pour la vaccination en général, les budgets sont fragmentés. S'il vous plaît, can you mute? Les budgets sont fragmentés et ont parfois une ligne pour les vaccins, la chaîne du froid, une autre ligne pour un certain nombre de services qui vont soutenir la délivrance et la distribution des vaccins. Donc vraiment un certain nombre de petites lignes, je crois qu'on en a compté jusqu'à une trentaine dans le budget de Madagascar, qui vont former un tout qui est peu cohérent pour la gestion des ressources. Donc cette question de la structure des budgets s'applique aussi pour, bien entendu, Et pour résoudre ce problème-là, on a vu que certains pays, même en l'absence de structure budgétaire par programme, on sait que c'est une transition qui est difficile pour les pays, donc même en l'absence de budgets qui sont formulés par programme, certains pays ont groupé les inputs ensemble et créé une sorte de ligne programmatique temporaire qui permettrait de grouper ensemble les inputs pour la vaccination Covid et d'avoir comme ça, si vous voulez, une sorte d'enveloppe budgétaire beaucoup plus consolidée et flexible à utiliser. Premier point sur la structure budgétaire. Deuxième point sur l'identification des détenteurs de budget, en français, budget holders in English. C'est une question importante parce qu'on sait que la vaccination va impliquer un certain nombre d'acteurs dans le secteur de la santé, mais aussi on voit dans un certain nombre de pays qu'il y a d'autres ministères qui sont impliqués, éducation, même parfois défense. On a vu aussi hier avec l'Afrique du Sud que le niveau provincial est directement en charge de la mise en œuvre. Donc d'un point de vue PFM, la question qui est importante est de bien identifier les budget holders, les détenteurs de budget dans le budget, les cost centers, afin que chacun ait son budget bien identifié et que de cette façon-là, on assure une exécution complète et je dirais aussi une ligne de redevabilité bien claire. D'un point de vue de l'exécution budgétaire, j'aimerais donc me focaliser sur deux points également parce que je crois qu'on a bien développé les autres points précédemment, notamment les règles de procurement. Donc, les deux points sur lesquels je voulais attirer votre attention ce matin, c'est tout d'abord la question du paiement et des incitatifs pour les fournisseurs de soins. On sait que souvent, cette question va être importante pour avoir des outputs qui sont en ligne avec nos attentes. Et donc, dans le cadre d'une vaccination au Covid, certains pays, en fait, ont réfléchi à mettre en place un certain nombre de paiements additionnels à la performance en faveur soit des fournisseurs de soins classiques, je dirais, donc de soins de santé primaire qui vont réaliser la vaccination ou alors en faveur de vaccinateurs qui auraient été recrutés de manière temporaire. Et je crois que cette question-là est importante à considérer et parfois nos cadres régulateurs de gestion des finances publiques ne le permettent pas forcément. Je crois que c'est un point important tout de même à considérer et à réfléchir. Le dernier point, c'est un point qui a trait à l'utilisation des ressources, en particulier pour la vaccination, donc tout ce qui sera le budget en dehors du vaccin lui-même, mais tout, je dirais, le petit matériel qui va tourner et qui va soutenir l'efficacité de la vaccination Covid. Donc, comment ces fonds, en fait, peuvent être utilisés par les fournisseurs de soins s'ils arrivent jusqu'à leur destination. Et notamment dans un certain nombre de pays, c'est le cas aux Philippines, mais je sais que c'est le cas aussi dans d'autres pays sur le continent, ils ont adapté leur régulation PFM pour permettre en fait aux providers, aux fournisseurs de soins, d'avoir un paiement à l'avance, d'accord? Donc, prospective payment in English for the translation, d'un paiement à l'avance afin de mieux, je dirais, accélérer leurs dépenses, avoir les moyens disponibles pour planifier leurs dépenses liées à la vaccination. Voilà, ce que je voulais partager avec vous et vraiment ensuite ouvrir la discussion sur comment vos pays réagissent au regard de ces différentes questions. La semaine prochaine, on va publier en fait une note qui va résumer l'entièreté de ces points et je partagerai avec Cabri le lien Internet où vous pourrez lire plus avant et regarder plus avant ce cadrage technique. Pour conclure, quelques remarques générales qui tiennent plutôt en fait à la place de la gestion des finances publiques dans la réponse au Covid, avant la vaccination, mais aussi pendant la vaccination, pour dire que, voilà, je crois qu'on est tous d'accord que la gestion des finances publiques, c'est vraiment une question importante, parfois négligée, pour la réponse au Covid. On a vu que dans un certain nombre de pays, des ajustements ont été nécessaires pour faire en sorte que les cadres de gestion des finances publiques permettent une réponse rapide, effective pour la Covid. Et la question que je voudrais poser aujourd'hui aux différents participants tient au fait qu'il serait peut-être intéressant de réfléchir à maintenir ou voir de quelle manière on pourrait maintenir un certain nombre des ajustements qui ont été introduits pendant cette crise afin d'avoir en fait un cadre de gestion des finances publiques qui soit peut-être plus adapté à la dépense de santé sur le long terme, dépense de santé qui, on le sait, a besoin de flexibilité parce que les besoins évoluent en permanence, il est difficile de les programmer pour la durée d'une année fiscale. Donc voilà, réfléchir à comment certains ajustements pourraient être maintenus à plus long terme. Je crois que si on voit les choses de manière positive, cette crise Covid pourrait permettre en effet de renouveler un peu le partenariat qu'il y a entre la santé et les autorités budgétaires et de gestion des finances publiques au sens large pour créer une sorte de nouvelle compréhension commune et un nouveau partenariat pour définir ensemble des options qui soient adaptées pour tous. Ici, vous avez les références des différents travaux qu'on a fait sur la gestion des finances publiques et le Covid, et je vous renvoie à ce portail de ressources avec le lien Internet qui s'affiche en blanc juste en bas, où en fait désormais on met l'entièreté des documents qui sont produits par l'OMS, mais aussi par les autres partenaires, pour ce qui concerne la gestion des finances publiques en santé, avec un accent particulier sur la Covid et la vaccination. Vous y trouverez bien entendu le mapping qui sortira la semaine prochaine, dont j'ai parlé ce matin. Merci beaucoup à tous pour votre attention.
Thank you very much, Dr. Barra. So yeah, I think you've given us enough food for thought, and I'm sure country representatives, particularly from ministries of finance, will be reflecting on the points made in the presentation and what their experience has been like. And you're welcome to provide your feedback or questions in the chat box, or raise your hands and speak up once the floor is open for questions and answers towards the end of the session. So now, without further ado, I'll invite Dr. Bakunama from Nigeria to speak to us about Nigeria's experience. Dr. Bakunama. Dr. Bakunawa, do we have Dr. Bakunawa?
He is with us, currently muted,
Okay.
so let's just ask to unmute.
And is the presentation will
hello, can you hear me now?
There we go.
Yes, we can hear you.
Hello.
I just wanted
Hello?
to check if the presentation is going to be shared by
Hello.
Daniel. Yes, we can hear you, Dr. Bakunawa.
It should be shared on our side. Chad, if you can bring that up, please. Great, thank you so much.
Okay, please go ahead, Dr. Bakunawa.
Dr. Bakanawa, you are on mute at the moment.
Hello, can you hear me now?
Yes, we can hear you. Dr. Bakunawa, you're on mute. We could hear you, but you put yourself back on mute. Dr. Bakunawa?
I may try get him on the phone, but he does seem to be having network issues. Perhaps,
Okay.
I don't know if anyone has any questions for Dr. Brawa and the interim.
Yeah, maybe we can do that.
Hello?
Yes, we can hear you.
Hello, can you hear me?
William, I suggest that you skip to the Q&A, and then if Daniel can then just get in contact with Bakanawa.
Hello?
Okay, okay, let's do that. So, if participants, if you have any question, feedback, or reflections on your country's experiences based on what Dr. Barra has just presented.
Hello?
Okay, Dr. Bakuna, can you speak, please?
Yes, please, I'm very sorry. I have some problem with the network, but I am connected now. Then I can take my presentation with your permission.
Okay, yeah, please go ahead.
Okay, so let me, please, if you can give me permission to share my screen so that I can.
It's already shared on our side.
Okay, yeah, I can share from my side because I added one slide just to give the status of some of the key listings for Nigeria.
Okay, maybe you can, I don't know if that's possible, Daniel, maybe you can share the English version and the French version.
Dr. Bakanua can share. He's got permission to share.
Okay.
Okay, so thank you very much. Am I permitted to share now?
Yes, you should be able to click share screen at the bottom. Otherwise, we can continue doing it from our side. It may be better for your bandwidth.
Okay.
But try share and then we'll see. We should. Okay, I'm going to suggest we share from our side and then, okay, oh, there you go. Great. Or you can just put into presenter mode, that'd be great. Thank you.
Okay, good.
So I can hear the voice here of my boss, Neil, and my other colleagues over there. So thank you very much for giving me this opportunity to take this presentation on behalf of my colleagues, Nigerian team. So the topic is on the planning for the COVID-19 vaccination program rollout in Nigeria. So this is the outline of the presentation. We'll be looking at the background, planning, coordination, and service delivery, data management, surveillance, and micro-planning, vaccine safety, cold chain, and logistics, as well as risk communication and demand generation. So as a background, Nigeria, when the pandemic was declared, so the one thing that we did as a country, looking at the overall planning process for the COVID-19 background, was to have a multi-sectoral COVID-19 vaccine introduction technical working group that was established and by the Executive Director, National Primary Healthcare Development Agency, Dr. Faisal Shaib, to ensure readiness for the timely COVID-19 vaccine introduction in the country. So it was a multi-sectoral because it involved all the other relevant organizations in the country that are really critical for the vaccine rollout. It is entirely different from the other vaccine introduction or rollout that we had in the previous years, being the fact that the nature of which the pandemic was declared and other related components. So it's made up of all the regulatory bodies, Ministry of Health, Finance, and other relevant NGOs, National Orientation Agency, civil society organization, and the media agencies. So the national vaccine deployment plan was also developed, so which will now guide the overall, that is, introduction of the vaccine in the country. So the MVDP was developed by the team, as well as also there was in line with what we are trying to really get as a country. So looking at the COVAX facility that initially we submitted interest to, and also the African Union platform. So the main objectives of the plan was also to introduce the COVID-19, as I earlier mentioned, in Nigeria, and to also scale or have herd immunity that will slow down or interrupt the transmission of COVID-19 in all parts of the country. That was the overall objectives of the plan. That's the National Vaccine Deployment Plan. So the country also were able to use the TWG to continue having daily meeting and track and monitor the status of preparedness, just like we said. So those are the four important coordination bodies that are derived from the National Technical Working Group. Those are planning, coordination, and service delivery. Then we have surveillance and micro planning. Then we also have vaccine safety and cold chain, as well as the risk communication. Those were the four main groups that were identified. However, in each of the subgroup, we also have some technical sub-teams that are working in a specific aspect of the overall introduction. For instance, the planning, coordination, and service delivery. So it's made up of service delivery component, and also we have the planning and coordination component. So the technical subcommittee have been up and doing since that time, because we started that one since during the lockdown period. So it was constituted, and we keep on working, first of all, to see the strategies that we can deploy to prevent the spread of the infection within the country. Those were the early strategies that we were working on as a technical working group. Then later also, we were able to, after the lockdown, we were able to streamline our direction to focus on the vaccine rollout. And you see some of the things that were achieved. So under the planning, coordination, and service delivery, so the federal government of Nigeria was able to identify some of the facilities that we have commitment to scale vaccine. So first of all, we have the COVAX facility. So we have an arrangement with the COVAX facility and of the doses of about over 16 million doses of AstraZeneca vaccine from Serum Institute through COVAX facility. That was the agreement was the vaccine will now arrive the country in February. And unfortunately also, as at the end of February, we were able to secure 3.924 million doses were received from the COVAX facility. We also have expecting a commitment through the African Union. They have approved approximately over about 41 million doses of AstraZeneca. So, and Johnson & Johnson about 18.4 million doses of the vaccines. And those were targeted to arrive in Q2, and already we are in Q2, that's Q2 of 2021, starting from this month to the end of June. So we are expecting those based on the earlier commitment through the AU, as well as the other vaccine, that's AstraZeneca and also Johnson & Johnson. So the government of India also, we have like a bilateral agreement, and they also promised to donate 100,000 doses of Covishield, which is AstraZeneca vaccine, to the federal government of Nigeria, which is also from the Serum Institute. Then we have Nigeria also is planned to receive 1.5 million doses of AstraZeneca, which was also a commitment from as a corporate social responsibility of MTN So the agreement was also to start with about 500,000 doses. So those were the commitment that we were earlier secured with all those organizations as a support to the government of Nigeria. And for all those vaccines that are promised to come into the country, so the federal government also, part of the agreement was to take over the responsibility of the overall operational cost for the vaccines that arrive into the country. So however, there may be some updates to those earlier agreements. For instance, we were expecting about over 16 million doses of AstraZeneca. However, in Q1 by February, however, what we received was 3.924. However, there are reasons for that, which a discussion are also ongoing with the country to see how they can fast track that. So the federal government vaccination is targeting the eligible population, which is from 18 years and above. So with an agreement that this will go in a phased approach. So a total eligible population that was targeted by the country, which is for 18 years and above, is 108,777,561. So that was the total of the
Dr. Bakunawa, you're breaking up. Can you hear me? Maybe you can switch off the video.
That was deployed. So I recommend.
Dr. Bakunawa, can you switch off the video? Maybe that will save bandwidth.
Hello?
Yes, you are breaking up.
Yeah.
So can you switch off the video, maybe, because it.
Yeah, okay, thank you. So just like I said, the SAGE, this is the strategy that was deployed by the country, which we refer to as a TEACH strategy. So this is part of the what we agree as a country. We're working with our partners that the strategy, first of all, the T stand for the traditional micro planning, because for us really to have a successful implementation or rollout of vaccine in Nigeria, during our planning process, we realized that we really need to combine different strategies. Those strategies that are traditional already, we have them within the country that we are using during our campaigns, as well as also routine immunization approach. Then with some other innovation that we already intend to deploy within the system. So we intend to have the traditional micro planning. So this one intend to have a comprehensive desk review of the micro plan that we have existing in the country. Then we also have the electronic self-registration of healthcare workers, because in our target, just like I earlier mentioned, we face the introduction or the rollout of vaccine in the country. So phase one is targeting the most important priority group, which is among them is the health workers. So part of the strategy is to use the electronic self-registration to make sure that all the eligible healthcare workers really register in this through the electronic platform. And also the frontline workers using a link that will be shared with all of them. And that was what was done. And currently that's the strategy that we are using for the phase one of the rollout of the vaccine. So the next strategy, which is assisted electronic registration of healthcare workers. So that one is also deployed, that in an event that some of the health workers could not register directly using self-registration. So there is a provision for them to be assisted during the vaccination process at the post of vaccination. So we have a dedicated recorder as well as electronic registrar that will now take care of the assisted registration. Then we also have the concomitant e-registration of general population. So that one we also intend to deploy that, just like the way we do our a normal registration. So we intend to have concomitant registration. So that concomitant registration will also take place during the vaccination of the eligible population. So just like apart from the assisted e-registration, we'll have also concomitant e-registration that will take place to ensure that all the eligible candidates are captured. Then we have housing will be deployed specifically to areas where there is a poor enrollment, so that they can be able to capture those that are not really properly enrolled. To the overall also, we are trying also to use, we are using the GIS maps also to make sure that we know those areas where we have dense population, so that we'll be able to capture them. So this is the strategy, the combined strategy that we use in the approach for the deployment of the COVID-19 vaccination in Nigeria. So in terms of the breakdown of the expected allocation, just like I earlier mentioned, those are the breakdowns. So this is just a repetition. We have Q1, Q2, Q3. So we were expecting, those are the doses of vaccine that were expected for the Q1, Q2, as well as Q3 of the vaccine. And this was what we have in our earlier preparation. So we have the AstraZeneca, as you can see, from this thing, first one. Then we have Johnson & Johnson. Those were the one that we were expecting to have in the 2021. And this is the way it is also spaced to be received. So in terms of the policies that we agree, or the phases of the vaccination. So phase one, which we are currently enrolling, is the priority group are the frontline health workers. And we also have some within the age of 60 to 69 category. So the eligible is about, we have 2.1 eligible person. So using the fixed post, their strategy is to deploy fixed post and temporary fixed post. Those are the key strategies that we are deploying. And initially, we targeted to use 10 days for that rollout. However, from where we are now, based on the challenges that we faced during the introduction, especially the vaccine hesitancy and some related issues, so we were able to extend the vaccination period from 10 days to close to a month now, because presently the vaccination is ongoing in the country. So the other phases, those are the phase two that we are targeting, those within the 50 to 59 years of age. And then we have also 70 plus, those are also targeted, and those within the age group of 18 to 49 years with comorbidities. Those are the target group, and it's about 33.3 million doses is targeted to be used for that. Then we also have post-3. So the phase 1, phase 2, phase 3, or post-1, post-2, post-3 are intended to be covered in 2021, while the fourth one, phase 4, is early 2022. So this is what we agreed during the planning to achieve. So in terms of what we have be able to deploy as a document or as a plan to achieve that, we have the National Primary Healthcare working with the partners. We're able to have a comprehensive training guide, which was completed and printed and distributed to all the assisted and FCG. And this is just the sample of the manual, the operational and training manual, as you can see, for COVID-19. Then we also have the plans that other IEC materials that are also embedded within, but they are also printed as a separate document. So the training plan is also to have the training materials ready at the state which were already sent. So we conducted the training of the national planning and meeting for the training on the 23rd to 24th of February. We have the training of trainers for the national was conducted between 25th and 27th. Then we have state level planning meetings, 1st to 2nd March, while the LGA level training was conducted between 3rd to 6th of March. So strategic politician launching of the vaccination started on the 8th of March, and it was started with the President of the Federal Republic of Nigeria and some other ministers, as well as the members of the Senate, and some other key strategic leaders were vaccinated on the 8th. And the general population, most of them in general, started around that 15. Some states started earlier than that. like where I am now, I am in the northeastern part of the country. I'm in Bauchi State. So we launched on the 12th of March, and starting with the governor of the state and some of the commissioners. So in terms of the data management, surveillance, and micro planning. So as part of the plan, the country also planned, just like we said, this is the first time as a country that we started using electronic registration and scheduling of health workers for vaccination and other eligible candidates. So this is just like a kind of pilot as a country, so that the intent is also to roll out the electronic registration system in the country moving forward, using even all the other routine immunization system. So we have a mini manual was also deployed for the e-registration process. And also we have the pre-testing before the formal launching of the platform. We pre-tested the platform in Buari, one of the area council in Abuja, the federal capital of Nigeria. So we also prioritize the health workers vaccination. So we share the link with them, and also to ensure that they started, those that have the capacity, they can do the self-registration. So in terms of operationalization of the e-registration, we are to use the mobile phones. Just is as simple as that. You can use your mobile phone to do the registration, and those are some of the the app show those links. So we train our health workers and also data managers on how to do this registration based on those steps. And we also deploy the mobile app was optimized in the form of web pages. So so this is just the self-registration protocol for COVID-19 vaccination. So we have the way it is. So for vaccination, just like we said, they can do self-registration. So those registration, usually we link them to the health facility so that for easy identification. We also have the, through the experience we have from SMS, as well as also using DHIS2. So the self-registration, the data that is generated, because already we have all our facilities are linked to the DHIS2. So we now link the registration with the DHIS2, linking the facility based on the fact that already the facilities are captured within the DHIS2. The idea is that DHIS2 is the platform that we are using to send all the health data in the country, and it is domiciled in the Federal Ministry of Health, and the vaccination module is being anchored by MPS-CDA. So those are the things. So the first part we have, the target was, as you can see, is to have the COVID-19 vaccination rolled out. Then later we would optimize this platform and transition it for routine immunization in the country, just like I earlier mentioned. So just like we said, initially in our vaccination processes, we were using hand-drawn maps for geographical information system. However, we now, for the mapping, we now transform to geographical information system to have a better high resolution for the maps, so that we can have a very detailed micro plan. So this is just like a kind of a comparison between the same area, Duru map was shown here, and you can see in Kano State. So we also have a kind of also a map on the other side to show a better resolution using the GIS map. So this is part of the transition that we were looking at. So, and this is the way we intend to do we did the micro plan. However, this micro plan processes will properly be deployed during the phase 2, because that is what we are now working on, because presently we are targeting health workers and other strategic members. However, during the rollout for phase 2, this is the approach that we want to do. So for every GIS map, we'll be able to divide the location so that we can have we can guide the team's functions during the vaccination process. What will be their target for day 1, what will be their target for day 2, day 3, and day 4, depending on the way it is organized by the state team. So in terms of the vaccine safety, cold chain, and logistics, so what we did as part of to optimize the cold chain system, So we try to divide the responsibilities between the federal government of Nigeria and the national and the state government, that's the subnational level. So the federal government of Nigeria took the responsibility of making sure that all the national strategic cold store, as well as other the zonal stores, were also optimized to receive the COVID-19 vaccine. So what we did was to make sure that, okay, we have provision for the vaccines, enough space for the vaccine, all in the country, using in the strategic cold store and other zonal stores. So we have national strategic cold store, which is located in Abuja, and we have one also in Lagos. Then we also have zonal stores in all the 6 geopolitical zones. So we also have, this thing came at the right time because we are being supported by Gavi for the CCOP platform. So already we have phase 1 of the CCOP deployment has already, phase 1, tranche 1 has already been completed, deployment and installation. So phase 1, tranche 2 installation is ongoing. So we make sure that all those things are fast-tracked so that we can have enough storage facility for the vaccine. So mostly we are using the solar system. So you can see here is also the colon ultra cold chain unit that we were able to procure in the country when we were expecting Pfizer vaccine. So this is the country procure ultra cold chain system to make sure that we have the adequate storage capacity for the vaccine in the country. And you can see here, this is a picture of our Director Logistics and Health Commodities. She was showcasing the ultra cold chain system that was really procured and installed in the country. So for COVID-19 vaccine arrival, we were able to deploy all the better strategies and also to make sure that all the key structures are in place. So in addition, in anticipation of the vaccine arrival, so the country also, just like I said, has all the distance. So for the COVAX facility, it will be deployed through the UNICEF Supply Division. So what we arrange is for them to have a kind of pre-alert at least 2 weeks before the arrival of vaccines, and also the other accompanying devices. And that was exactly what we did when we were expecting the AstraZeneca vaccine. So the COVID-19 vaccine also devices will be airlifted from Nnamdi Azikiwe International Airport. Then the clearing of the vaccine will be done within 24 hours. That was what we also made arrangement, working with all the relevant regulatory agencies like the NAFDAC and other relevant agencies that are part of the technical working group that was instituted. And the vaccine delivered to strategic cold store, the inspection as well as the necessary documentation will be done within 24 hours. So we also mandated the NAFDAC to take sample from each of the batch of vaccine that arrived the country to do the quality checks to ensure that it is within it meet up with the global standard, and also issue batch certificate. So it's in alignment with what was received. Then electronic vaccination arrival report to be sent to UNICEF Supply Division within 72 hours of arrival. So this was one of those strategies that was placed. First of all, the cold chain system was optimized. Second, there was an arrangement for at least with Supply Division of UNICEF to have pre-alert at least 2 weeks. Then we also have the National Strategic Cold Store ready, then clearing within 24 hours. Then analysis by NAFDAC for the quality check, as well as the electronic report will send to the supply division of UNICEF within 72 hours of the arrival. And that was exactly what was done during the first tranche of the vaccine that arrived the country. So in terms of—
Excuse me, Dr. Bakunawa, can you wrap up in 2-3 minutes, please?
Okay, so thank you. So for the vaccine, the storage is just within what we already know. The temperature monitoring system was also optimized to make sure that the vaccine potency is kept within what was expected. Then the distribution of COVID-19 was also in line with our routine immunization system. So, and it is also a form of bundle vaccine. So vaccine accountability, traceability, as well as reverse logistics was also arranged in such a way that the number of vaccines that are received by each of the states, they will have to account for the same number of vials that was utilized. So to ensure that this happens, we also identify accountability, vaccine accountability officers at the state, national, and also the LGA level. So waste management system was also institutionalized in place. Then this is the waste disposal management flow that was also done. So in terms of the risk communication, we have pre-arrival address of the vaccine safety, which was done. Those are the phases. Then we have arrival and vaccination phase, and we have post-vaccination. So we targeted the planning and our planning meeting to have those three pre-arrival vaccination safety messages and activities. We have arrival and vaccination, that's concurrently. Then we have post-vaccination. Those are the strategies that are deployed and the channel of communication. In terms of the rumor management, we have risk communication and rumor management for COVID-19 was also instituted. Then those are the steps for the rumor process management deployed in the country, and it was optimized based on the existing protocol that we have. So in terms of the status of implementation, Nigeria, just like I say, as an update, it was since 27th of February in Lagos, the first case, index case, and also it was spread to geopolitical zone. To date, we have 163,911 confirmed cases as of today, this morning, and about over 154 recoveries, and we have 2,061 deaths so far, and we have 76 active cases presently, and we have vaccinated over 1,378,631. That's just 68.5% of the phase one, and phase one we were just targeting. So this is the map showing all the green areas. Those are the states that either they completed or they have started enrolling, while Kogi was the one that was delayed due to some cold chain system that were pending by the state, and after, but now they are also green. So this is the status of the vaccination, and this is where the state are. All the states with the light color green is indicating that they have reached the target that was assigned to them by the country. In terms of the key challenges, we have the uncertainty of the timing of the vaccine arrival as one of the key challenges, alignment between the EMIT data and the call-in data, that's electronic management for immunization data that was deployed, and the call-in data. We have capacity gap at the subnational level that we are trying also to optimize. We have funding gap for the pre-implementation activities, and we have vaccine hesitancy and also network issues in some states. Finally, those are the key steps that we are looking at the country. The national review of the phase one will be done immediately after we conclude in the state. Then identification of key lessons learned from phase one that can be deployed for the phase two. Then preparation of other phases of introduction, that's phase two, phase three, phase four. Then transitioning of EMIT data, that's electronic management of immunization data, from campaign mode that we are currently doing for COVID-19 to the routine immunization system. Then sustainability of the gains of COVID-19 introduction, those lessons learned. We want to sustain the best practices. So this is a very brief summary of what we have done so far in terms of planning and COVID-19 rollout in Nigeria. One thing that I also want to make in my concluding statement is, like, presently we are having daily review at the national level, and all the taxis and FCT, they are also deploying, rolling out with us. Thank you very much, and over.
Thank you, Dr. Bakunawa, for a very comprehensive, detailed overview of what Nigeria is doing in terms of the rollout of the vaccines. Okay, so now I will open for questions and answer. So we have received a few questions in the chat box for both Dr. Helen Barwa and Dr. Bakunawa. So maybe we can start with Dr. Helen Barwa. I'm sure you have already seen and also interacted with some of the questionnaires. So just to put it out into the plenary for everyone to hear the questions. The questions are related to the point you made about the long-term implications of the adjustments that countries are making and how they can sustain those adjustments and the lessons that they can draw from these adjustments and in terms of more long-term PFM reform. So can you provide your answer to those questions, Dr. Helen?
Oui, merci beaucoup. Donc, je vais continuer à répondre en français. J'ai fourni quelques idées dans le chat. Donc, effectivement, le point que je soulignais était lié au fait que un certain nombre d'ajustements qui ont été faits dans les systèmes de gestion des finances publiques pendant la crise pourraient être continués dans la période qui suit. Ça implique un certain nombre de changements effectivement dans les cadres existants et les régulations liées à la gestion des finances publiques. Mais comme je le disais aussi, en fait, dans certains pays qui sont d'ailleurs qui étaient avant la crise en train de mettre à jour, de faire évoluer leur cadre de gestion des finances publiques, beaucoup de pays, on le sait, sont en pleine réforme de gestion des finances publiques. Donc, déjà, dans ces pays, il y a un certain nombre de modalités réglementaires qui ont été actées et qui parfois sont sous-utilisées, en fait. Et parfois, les acteurs de la santé ne sont pas forcément au courant de toutes les modalités qui existent. Par exemple, dans un certain nombre de pays, aujourd'hui, même si on n'est pas avec un budget par programme, même si on a toujours un budget par intrant, il y a la flexibilité pour réallouer, souvent autour de 10 ou 20% entre ces lignes par intrant. Et parfois, parfois, les acteurs de la santé ne sont pas au courant en fait, de cette flexibilité existante et ne l'utilisent pas. Donc, oui, il y a besoin de mettre à jour les cadres, mais aussi de mieux les connaître, en fait. Et pour finir cette réponse, j'ai partagé 2 idées principales concernant l'évolution des systèmes de gestion des finances publiques. Un, c'est accélérer la transition vers la budgétisation par programme ou par output qui est initiée dans un certain nombre de pays. On sait que c'est une transition qui est complexe, mais qui vraiment mérite d'être finalisée parce que d'un point de vue de la dépense de la santé, ça a un certain nombre de bénéfices pour permettre une réponse beaucoup plus... Ensuite, deuxième chose, ajuster aussi les modalités de dépenses et permettre dans certains pays aux fournisseurs de soins d'avoir accès aux fonds. Dans certains pays, précédemment, c'est simplement au niveau du district que les fonds restaient et les formations sanitaires n'avaient pas accès aux fonds. Donc, pour citer l'exemple d'un pays du continent, la Tanzanie, par exemple, est en train de faire une réforme et de mettre à jour ses cadres de gestion des finances publiques pour permettre un transfert budgétaire directement vers les formations sanitaires, donc du Trésor vers les formations sanitaires, et de mettre un certain nombre de cadres et de régulations pour que ces fonds soient bien utilisés et bien rapportés par les formations sanitaires pour couvrir leurs coûts opérationnels. Donc ça, c'est aussi un point qui me paraît intéressant et qui a déjà été initié par certains pays. Voilà, je vais arrêter ici.
Thanks, Dr. Helen Barra. So if I can follow up while I have you here. So I was wondering about whether your review, in your review, you've observed any distinction between countries that have recently dealt with a health emergency like the Ebola crisis in how their PFM systems adapt to the COVID crisis and also to their readiness for the rollout of the vaccines.
I think this is really an interesting question. I'm not a specialist of Ebola, and especially how those PFM systems have been adjusted or not following this crisis, the Ebola epidemics. But from what I know is that I'm not sure that we, collectively have really taken on board the lessons from previous crises, from the Ebola crisis, from other pandemics that happened in Asia or in the MENA regions. And because from a PFM perspective, when we looked at the realities, the practices of PFM today, we realized that most of the PFM systems were actually did not actually include the appropriate provisions to be able to respond to such a crisis in a flexible way, in a responsive way, in a quick way. So that's the reason, and that was the focus of our previous work. That's the reason why PFM systems had to be adapted really when this crisis has started, to be able to make the modalities more adapted and to make the modalities feed the requirements of the spending in an emergency. So I think the message is that these crises should really prompt us to take the lessons this time. I think the lesson is for all and every country, including our income countries, to really adapt, prepare better their PFM systems for future shocks, but also for regular spending in the sector. As I said, we know that this particular health sector requires some flexibility on a routine basis, right? So I think it's certainly something that should be this time really taken more seriously.
Thank you. Thanks very much. So let's now move on to the questions to Dr. Bakunawa. So there's a question in the chat box about Nigeria's experience of transitioning away from Gavi support, and whether the lessons from that transition are going to benefit Nigeria in terms of rolling out the COVID vaccines, and to what extent has the government of Nigeria taken ownership of the vaccine programs implementation vis-a-vis relying on non-governmental actors? That's a question to Dr. Bakuna.
Yeah, so thank you very much for having me, and thanks for posing this important question. In terms of the lessons learned from Gavi transition, vis-a-vis how we are also leveraging on that experience for COVID-19 rollout, I think this is a very important question. First thing, you may recall that the country was able to use using from Gavi transition to develop a Nigerian strategy for immunization and PSC. So based on that strategy, that is what we are currently implementing. So we have both a kind of support as well as health system support as part of the transitioning strategy for Gavi, out of Gavi's support. So from that current time to date, we have a kind of robust team in the country that is also monitoring and working on the transition. And the lessons learned was actually very useful in ensuring the successful COVID-19 campaign rollout in the country, in the sense that in part of the transition, we also have embedded a lot of campaigns, some related to polio endgame, while others related to some of the outbreak responses. And we use the lessons learned from those to ensure that we improve in the case of the rolling out for COVID-19 vaccine. You can see also from the teach strategy that I show in my slides, that we are using the traditional system. The traditional system was what we already inherited. What was new in our rollout system that we deploy is the use of electronic management of immunization data. That was what was new. But all the other strategies is from what we have learned from the transition. And in addition to that, also for the transition, as part of what we have learned from Gavi transition, working with other countries in the platform that we have, learning network for countries in transition. So I am the also focal person for that learning network. So, and at the same time, we are working as a team. So we transited part of our core group for the learning network into vaccine financing and accountability tax team. So we have vaccine financing and accountability tax team, which is also working on the Gavi transition. So the members of that team, they are also strategic members of the current COVID-19 rollout that we are doing. And we use the lessons learned and also some of the interaction from other countries to also improve the vaccination rollout in the country. So in terms of okay, that is the first question. I think I saw also one of the questions in the chat box. Can I go ahead?
Yes,
that was also asking about the tool that was used in whether we were able to course our national vaccine deployment plan, and what tool have we used, and also in terms of do we have that course. So thank you very much. So just like I said, as an addition, so in the country we have support from Gavi. So Gavi, we have our consultant, and we have also vaccine our consultants that are working on immunization financing generally. So the same team that was used, I was also part of that group, being the Gavi focal person for the country. So we use our experience from other one. There was a tool, I can't remember the name of the tool that was used, but I know that we have received from COVAX facility, we have received some tools as a guide. We also work with WHO and also World Bank. Those are some of the key members that we use, as well as also UNICEF, because the deployment or procurement of vaccine that we are using in the country is through UNICEF Supply Division. So we use the tool provided by those organizations to also cost our intervention. And we're able to have the cost, and the cost, we have the Gavi funding. We also have the funding from the federal government for the vaccine procurement cost. We also have that of vaccine delivery cost, and also and some other related activity that has to do with the communication. And in the total, we have a significant proportion of that coming from the government of Nigeria. But in a total, what we have overall for the cost for all the strategies that are deployed, we have over 188,276,366,300. That was the initial budget that was reached by the team, over 188 billion naira, which was equivalent to about 487 million over 487 million US dollars. So this is the overall total cost for our vaccine, for our plan that was deployed. And the plan is about 120 pager document that I have here. I don't know if you can also allow me to project this page so that you can be able to see the cost that I just said for the vaccine deployment. So can you see my screen now?
Yes.
Okay, so this is our National Vaccine Deployment Plan. This is the copy of the National Vaccine Deployment Plan, and you can see also the initial cost that was agreed, that was developed by the team. So summary of the estimated budget for COVID-19 vaccine procurement and operational costs. That's for the overall deployment. So just like I said, for the vaccine procurement, and this is what we have, and which is this is the commitment of the federal government of Nigeria, and this is the tune. And for the vaccine rollout, so this is the estimate of the total cost that we need for the vaccine rollout. This is coming overall starting from the planning processes that are happening at the national trainings, deployment of data, relevant data tool, electronic management system, and all the others. So we arrive at this particular total for the operational cost for the 2021 as well as that of 2022. So this is actually what we have as a overall total cost for the deployment plan that we have for the country.
Thanks, Dr. Bagna. There's a follow-up question from Daniel in the chat box about whether this total cost has been included in the supplementary budget.
Yes, so just like I said, even the present activity that are ongoing, so there was an emergency fund that the federal government released for all the operational costs that is for phase 1 that is ongoing. It was from the federal government of Nigeria. And this is part of the commitment that the federal government showed. Just like I said, always immunization is a priority, and the government is always ready to make any decision. So for this course, already there was a plan to put this one into the budget of the country. Already we have that plan, and there is a dedicated team that are working on that. We have budget as well as the finance, as well as we have the budget unit of the Federal Ministry of Health and MPSCA. So they are working to ensure that all these costs, the final figure entered into the federal government budget of supplementary budget of 2021, as well as the budget for 2022, for those phases that will take place. So definitely, just like I said, some of the things that are also delaying us because of the uncertainty, just like we are seeing in other countries. So we have uncertainty in terms of when is the vaccine going to be available for Africa generally, and also for Nigeria. So until we have the certainties, that will also inform whatever a shift we may make to our budget processes. However, all the figures are already finalized. I don't think this is the last figure, but this is what I have as at now. But I can follow up with the team in case if we want to also share those documents with you. So this is actually what we have as a country. Thank you.
Okay. Thank you, Dr. Baknawat. So this has brought us to the end of the session. I would like to thank our presenters for excellent presentations and for the questions. Thank you, everyone. I will hand it over back to Daniel. Thank you.
Thanks so much, Benjamin. Yep, great session. Really comprehensive from both Helen and Dr. Bakanua. So we're now going to hear some concluding remarks from CABRI's Executive Secretary, Neil Cole. And once Neil's concluded, we're going to send you a link for an evaluation survey, and I'll be grateful if everyone can complete that after the event. Thanks, Neil. Over to you.
Thank you. Thank you very much, Danielle, and really enjoyed the past 2 days, particularly very interesting presentations that were made today. So just a couple of concluding points that we as the CABRI Secretariat take away from the past 2 days, and also informed by the work that we have been doing as a build up to this policy dialogue. I mean, what we certainly have come to know is that over the, and this is, I suppose, over a period of 14, 15 months, we know that we entered a pandemic, and in that sort of period that followed, where the development of vaccines were being produced, and now with the acquisition of those vaccines, we became aware of the many unknowns, right? Unknowns about the virus, and some of these still exist, but there were also many knowns. We certainly had a sense of who had the capability to produce vaccines and the capacity. And some of those unknowns and knowns are linked still today to the challenges that we are facing, particularly related to the financing and procurement and distribution of vaccines. Sorry. With the financing for COVID-19 vaccines coming out of the 2-day discussions, it's clear that we're going to require the appropriate levels of external and domestic resources. The role of private insurance companies will also need to be considered, and this is largely because of the urgency, but it also relates to some issues around weak areas within the health sector. And as Daniel indicated in her recap points that she made this morning, domestic resources are going to be crucial for closing the financing gap. Right? Being transparent, despite some of the points that were raised yesterday relating to the opaqueness from the pharmaceutical industry, being transparent on the part of governments will certainly signal our commitment to development partners and our other partners, and also act as a catalyst for some of that external support. So transparency, accountability, very important. We still do not have comprehensive data on how countries are financing, budgeting, and procuring the COVID-19 vaccine. And without this, the opportunities for peer exchange and learning, and especially cross-continental activities and the kind of coordination that we're seeking is going to be limited. Just another point on transparency that I think is worth reiterating is that there is variances in vaccine prices and lack of price transparency that further contribute towards costing uncertainties. The point was made, I think, very eloquently by the African Medical Supplies platform, that coordination and working at a regional level is certainly going to help to bring about greater certainty when efforts and resources are pooled, and where you are now acquiring at a bigger scale. So yeah, by taking a regional approach, as was said by the African Medical Supplies platform, African countries have the opportunity to procure vaccines through the approach that has been put in place alongside country level programs. And I don't think that it is a case of either or. I think countries that have successfully launched their vaccination programs have participated in and undertaken this acquisition using both approaches. I think that is important. We should continue, I believe, to share the lessons from these country level vaccination programs, as we heard yesterday from especially Mauritius and Seychelles and South Africa. And these are provided very valuable lessons going forward. This pandemic has brought to the fore, once again, the underinvestment in the health sector. And I think it is important to make this point, and certainly a point that has been brought out, especially in the presentations made by the WHO. And what it has brought to the fore is how unprepared we are at a country level, at a regional level, but also at a global level. I think many commentators, in reflecting on the global response to the pandemic, one of the criticisms have been the lack of multilateral action, the lack of coordination at a global level. And I think going forward and coming out of this pandemic, and certainly the ongoing lessons, is that coordination at all levels is going to be important. So that intra and extra governmental coordination at a regional level, but also at extra governmental global level. This is going to be important because we're going to have to be thinking about the investments we need to make within the health sector to deal with future pandemics. And for African countries, I mean, in developing countries, this investment is going to have to also be an investment alongside our response to our existing disease burden that we have on the continent. I think Philip certainly pointed to some of those points in the panel yesterday. So as African countries build up, as we build up our resilience and disaster management responses, we're going to also have to take a longer term view. And part of that longer term view and strengthening of the resilience, the point made by Helene is very important, is the strengthening of the public finance management system. This is going to be important for normal times, but certainly a strong public finance management system is crucial in responding to crises like the one that we're currently experiencing. So let me end in terms of my substantive points with that point. And what remains is just to thank everyone. And in thanking everyone, let me single out the Egyptian Vice Minister that joined us yesterday, the Director General from Nigeria, the Permanent Secretary and Assistant Permanent Secretary from Mauritius, the distinguished participants from country governments, and especially those representatives that took the time to prepare these excellent presentations that we've heard over the past 2 days. Thank you very much. To our partners, WHO, African Medical Supplies Platform, and others that joined us. Thank you very much for the time and for sharing your insights. Let me also thank the CABRI Secretariat, the CABRI team, and the person that takes the lead in our work on health financing, Daniel Cerebro. Thank you very much. And then last but never least is to thank the interpreters and the behind the scenes technical support that is provided. Thank you very much. Back to you, Daniel.
Thanks so much, Neil. You took all my thanks, but I echo your appreciation for everyone who presented and our logistics team. Thank you so much. I think it went really smoothly. We're now going to put up a link for the evaluation, and if everyone can just complete that to allow us to tailor our next activities. Let us know where people want us to be focusing and any logistical issues that you may have noticed that we can improve on. So yeah, put that link up please now, guys. Thanks so much. Before everyone logs off. Thank you.
Thank you, Neil. I can see you are doing very well. This is Bakunawa, your student.
Wow, that is the best compliment that I could ever receive. Thank you very much.
Thank you very much. I'm using that our PFM knowledge very well and interacting with my finance colleague in Nigeria. Thank you very much for the support.
Thank you. I can't wait to visit you in Abuja to come around to the center. It looks like that's where you're sitting at the moment.
Yeah, this is one of the centers, but this is in the Northeast. It's one of the National Emergency Polio Operation Center. Where I was earlier, the network was poor, so I have to relocate to this center where the network is much better. So this is one of the centers that we have for polio eradication.
Thank you very much. Let me leave you to complete the evaluation, but okay. we will be in contact.
Thank you very much.
Thanks so much. And we will also send the evaluation via email for anyone who doesn't manage to complete it now, but yeah, I'll appreciate if you can get to that now. So thank you so much. It's in the chat box. Thanks, everyone. We look forward to doing this again, and we'll see what you guys are interested in through the survey results.